is setting stage to introduce Moses, who is the main character of the book of Exodus. But how the writer of Exodus introduces Moses has something to do with the ministry, the influence, and the impact of Save the Mothers. Moses was born at a time when things were very, very difficult, in that the Israelites were being persecuted. The ruling king wanted to decrease the number of the Israelites and thought that the best way to do it was to kill the male children. But in the verses we read today, we read about two wonderful women, the midwives, Shiphrah and the other difficult name. These two midwives and what they did. And from these verses, they're just two take homes I want us to reflect on. The first one is this, that God intervenes through human action. God intervenes through human action. Ultimately, the saving of Israel, and that they were able to spend the years they did in Egypt, was the work of God. But for that to happen, someone among the human beings had to take action. It's these nurses who take action, these midwives who take action for the male children to be saved. There is a very, very important principle for all of us, not only those of us serving in the church, but everywhere we serve, the principle of human instrumentation. That the all-knowing God, the almighty God, the God who is present in every generation, will work through human instruments. God saving the Israelites through these midwives. The nurses, what these nurses did saved many babies, and in saving the boy child, they also saved their mothers. Notice that their actions were based on their fear of the Lord. Not just their expertise, but their fear of the Lord. The scripture doesn't tell us that they were believers in Yahweh, the God of Israel, but they had this concept, this conviction about what they do being seen by God and what they do having to give account to the Lord ultimately in their lives. They feared the Lord. This was their primary motivation for what they did. So the first point is that God intervenes through human action. The second and last point is the idea that God blessed these midwives. God blessed these midwives. The language of my translation is God dealt well with them. God dealt well with them. And that is all encompassing. Of course, readers of the Bible again will remember that later on, God is going to punish the gods of Egypt, and God is going to punish the rulers of Egypt and the people of Egypt. But again, this line introduces us to exceptions within a context where people are facing the wrath of God, exceptions that God dealt well with them. The message for you and me is this: God remembers and God rewards. God remembers and God rewards. Many times as we undertake whatever we are doing, as we propagate the influence of STM, it will be out of sacrifice. The circumstances and conditions may be hard, but the message we get this morning from Exodus 1 is that God remembers and God rewards. So in conclusion, what we are doing through STM may be small in comparison with the need, but it is making a difference because God is working through us and God notices what we do. Let us pray. Again, Heavenly Father, we continue to recognize that we gather in your name. And so we pray that in everything that happens in today's conference, in today's meeting, your name will be glorified. We yield to your presence and yield to your guidance. We thank you for our masters of ceremony, and we thank you for our keynote speakers. We thank you for our session leaders, and we pray that you'll guide them according to your will. We pause to remember all the men and women who have been through this program, and where you have sent them as ambassadors, as missionaries for the work of saving mothers. May you continue to strengthen their hands, and may you continue to impact communities all across this region. Lord, in a special way, we pray for all mothers, in particular expecting mothers, that even as we seek to be of help to them, Lord, you will undertake for them in their various circumstances. Thank you for hearing our prayer. For this we pray in Jesus' name. Amen. God bless you.
Thank you, Reverend Engineer Sembiro. Are we ready for our anthem? Okay. Shall we stand up as let me all be praise voice. Praise the Lord, praise the Lord. Let the people rejoice. To the Father, through Jesus the Son, and with him the glory, praising him as now. Okay, thank you. May have our seats. Once again, you're very welcome. We are happy to have you today at this Save the Mothers East Africa 2024 MCH conference. I hope we all have the program. The booklet is online. Sorry, we are about 10 minutes behind schedule, but we will catch up because I believe that we are all great at managing our time. Once again, my name is Joan Mugenzi, an alumni STM, that's Save the Mothers Program 2005 to 2007. So I'm happy to see that the professors that started us off are here with us. Where is Dr. Chamberlain? Where has she disappeared to? Okay, yes, she started us off. And I remember I was among those people that she interviewed while she was trying to do the back end check to see whether the program was feasible. Thank you so much. I'm happy to see my supervisor, Professor Pius Okong, in the room. Yes, it's because of him that I was able to make it in record time. Because when you are a working student, it might not be that easy, but here we are. Professor Mirembe, happy to see you, and a very warm welcome to each one of us. I know that our teas are ready and it's a cold morning, but this is how I'm going to guide. We will get somebody at the table to just ensure that only 2 to 3 people go to the other side to serve. We'll be having a working tea. I hope that is okay, so that we are all not getting up at the same time and be able to continue with the program. So I would like to invite our STM East Africa Executive Director, Dr. Mushin, to come and welcome us into this place. You're welcome.
Praise the Lord. I think that is too small for the Lord. We shall do it once more such that we can warm up. Praise the Lord. That is now much, much better. You know, the Lord always deserves the best, isn't it? Good morning, everyone. My name is Dr. Nsubuga Mushin, the Executive Director, Save the Mothers, East Africa. I know many people we've met virtually, and a few of us have met physically. I praise the Lord that today we are under one shelter and we are meeting physically. So all protocol observed, the guests, the delegates, and all of us advocates of change, you're welcome to Uganda Christian University. But more so, you're welcome to Save the Mothers. And we greet you in the name of our Lord Jesus Christ. Today we stand united for a very good purpose. And it's so beautiful to see how we draw all our strengths and shared commitments towards maternal and child health. This is so beautiful. We are honored to convene in this gathering in partnership with all the students of Masters of Public Health Leadership, but more so the alumni. We welcome you so much, and we are proud of you. Uganda Christian University, we thank you so much for hosting Save the Mothers and working with Save the Mothers all the past 19 years. We don't take this for granted. All the other non-government organizations present, we welcome you to Uganda Christian University. Ministry of Health, we welcome you to Save the Mothers and Uganda Christian University. The board members of Save the Mothers, we have the team from USA. Sean. We have the team from the board of Save the Mothers Canada. And in a special way, also the team of the board of Save the Mothers East Africa. And the founders of Save the Mothers. You're so welcome today. 19 years ago, Save the Mothers embarked on a journey to champion safe motherhood using a multidisciplinary approach. Now, this is quite a special approach. Why is it so special? Mothers are dying today because of various reasons, which were summarized into the 3 delays majorly. When you understand the 3 delays, and the first delay is the mother delays to make a decision to come to hospital. The second delay is when the mother decides finally that I want to go to hospital to seek health care, they are delayed between home and the health facility. The third delay is when these mothers finally arrive in the hospital or the health facility, after going through the first 2 delays, there are challenges in the health facility that will lead to the delay of actually getting the actual treatment they need. And 12 mothers are going to end up dying by the end of today in Uganda because of the 3 what? Now, all those delays are caused because of very many factors. And the health workers can only address 10% of this. Now, that's why the multidisciplinary approach is important. Because the lawyer in this house, the journalist in this house, the doctor in this house, the father, the member of parliament, the vice chancellor, the chaplain, contributes to the rest of the 90% of making sure that this mother doesn't die. Now, that's why this meeting is very important, and we welcome you. So through the multidisciplinary approach, Save the Mothers thought that we should have a Masters of Public Health Leadership. And how important is this Masters of Public Health Leadership? Is to ensure that we are equipping the few medical personnel who are addressing the 10%, but more so the rest of the non-medical 90% who are addressing the 90%. We equip them with the skills to understand the challenges the mothers go through when they are delivering that lead to their death, and be able to address them using the simplest interventions in our societies and communities. Now, that's why Masters of Public Health Leadership program is very important. The other intervention was the Mother Baby Friendly Hospital Initiative. And through the Mother Baby Friendly Hospital Initiative, Save the Mothers is saying a mother should have, number 1, a safe delivery. What does safe mean? Safe means you come to the hospital, deliver your baby, go home with a smile when you are alive, and the baby is also alive, but also a happy family because they are taking you back home. That is what we call safe delivery. But not only safe, we are saying that delivery should be safe and dignified. Now, what does dignified mean? It means when I come to a health facility to deliver, it should be clean. I should meet welcoming people. I should not be slapped when I'm delivering. I should be talked to kindly. I should be able to appreciate the importance of bringing forth a new generation. And this is the purpose of God. If you listened very well to what Chaplain was talking about, it's clearly in line. So as Save the Mothers, I believe we are God sent, as Chaplain said. And we praise the Lord for this, and we should be proud of ourselves. So as Save the Mothers, we've been able to reach out to 15 Mother Baby Friendly Hospital Initiative through our 10-point programs. Several high dependency units have been set up in these Mother Baby Friendly Hospital initiatives. High dependency units are areas where mothers who have very high risk of dying during childbirth, number one, they are identified and they are observed closely. And in case of an event that one of these bad causes of death come forth to this mother, they are identified quickly and managed in time. Now that's the purpose of these high dependency units. And Save the Mothers has done good in that area. So let's join together and realize the mission and the vision of Save the Mothers. The mission of Save the Mothers is no baby or mother should die from preventable causes. But not only dying from preventable causes, a mother may deliver and not die, but be harmed. For example, mothers who go away with fistula, they deliver a baby and they leak stool or urine the rest of their lives. Now that's harm. So we are saying you may not die, but you shouldn't be harmed just because you've delivered a baby. Now that's why we are here. 500 alumni have gone through this program and we thank God for this impact. At Save the Mothers, we don't only count the alumni. Once you hear 500 alumni, we are counting 500 change projects that are impacting lives of mothers. Imagine 500 change projects that are not necessarily blood transfusion, are not necessarily a cesarean section, but ensuring that a teenager doesn't get early pregnancies to end up dying, as you're going to see in many of the abstracts that are going to be presented. I think we need to thank God for this program. We welcome you to UCU and to the 2024 Safe Motherhood, Save the Mothers Conference. Thank you so much.
Thank you, Dr. Mushin, and also for reminding us about our conference theme that no mother or child should die or be harmed due to preventable childbirth-related complications, the role of multidisciplinary professionals. And that's why we are here, that we are multidisciplinary, and we want to see how each one of us contributes to this agenda that no woman should die as a result of childbirth or be harmed by childbirth. And without further ado, Dr. Olive Sentumbo, you're very welcome. We are happy to have you lead us through the next session, to give us a little bit of your own opening remarks, but lead us to the exhibitions. We are all ready to start us off. Very welcome.
Good morning, colleagues. All our invited guests, ladies and gentlemen, the alumni members, and really members of the media, everybody who has had an opportunity to be here this morning, I welcome you to yet another congregation for all of us who believe in the safety and the health of the mothers and newborns of this country. You're welcome. For me, and for many of us who have been at the front line of supporting mothers and their families to yet bring into forth a newborn baby. I think it has been a wonderful experience. How many years are we counting now down the line, Prof? How many? 19 years. Those are adolescents who are also, we are adolescents, but we are moving into the younger adult, isn't it? So I think this program has grown, and I'm very, very, very excited to see Professor Chamberlain. Welcome, welcome, welcome. Indeed, we are very excited. Professor Kong, Professor Mirembe, and the leadership of this great university who made it possible for this course to be present. And indeed, all the great people that have passed through and the things that you are doing, the projects, there's so many projects that are in this country. And now we are speaking about East Africa and beyond East Africa. I think that's a huge, huge achievement. Thank you. Thank you very much for the university which is hosting this. Thank you to the founders of this great concept and now a complete learning we are all experiencing. I have met several of the students who passed through these great hands of UCU through this course, and they are doing wonderful things. We are seeing them in the government, in various sectors. We are seeing them in the UN bodies, and indeed, they are there making sure that they are frontlining and they are working on issues that change mothers' lives. I want to thank all of us for the work that is being done. I also want to thank the Ministry of Health, where our course belongs. I think that is where it is sitting. I think great progress has been made overall. If you look at the results of the Uganda Demographic Health Survey 2022, it is giving us hope. For us, we are seeing a gradual decrease in the mothers who are dying because of pregnancy-related causes. In 2016, we were at a 336 per 100,000 live births. For those of you who may not have heard the news, we are at 189. That is no mean achievement, and I think it's the work of everybody who is seated here. Each of us doing small things and eventually making impact in the communities in which we work. Of course, the health of the newborn and that is the perinatal health has not moved to the same level. And definitely we know that there are factors still in the community which are still giving us the first and the second delay, and sometimes indeed the third delay. And because the baby is more vulnerable, the newborn is more vulnerable, or the fetus is more vulnerable, it comes out that we are having that persistent higher number. But still, we have moved from 27 per 1,000 to 20 per 1,000. And we think that the focus now, which has been, or which is being given to the health of the newborn and the fetus, is also going to give us good results. The ministry is pronouncing itself on the importance of improving the quality of antenatal care, improving the quality of intrapartum care, and we have adopted the WHO standards. And now I want to say that many of you, like, is it Busoga? Busoga sub-region, we have a local maternity network where many of the people, I don't know whether they are here. Busoga, we want to congratulate these colleagues because they've started important things in their regions. They are networking, they are working with everybody to make sure that we are going into the communities, we are talking to them, and we are informing communities, mothers and their husbands, and their families in general, how a pregnant mother is precious, is vulnerable, and we need to do things differently for her at the family unit level. We believe that with everybody somehow where they are getting convinced that we need to do differently, we need to make sure that the woman is coming for antenatal, that the woman has money to bring her for the services she needs, and that the husband is very close. The husband is very close. We are all believing in these critical interventions, and I think we are scaling. We are going to scale. And I want to thank you, each of you, the way you have coordinated and networked in the different regions. And I think that those of us who are coming from other regions, I think even, is it Gulu? I think Gulu, we also have some colleagues there in that northern part. We do believe that if we continue to influence like this, we should be able to reach far. And if we are really a team, we should now be influencing sectors. And I do hope, and I do know that we can still get there in big numbers and make a difference in the different sectors that will make a difference in the health of the woman. We need the roads. We need the bridges. Now, if the bridges are breaking down, how will the women reach the health facilities? The roads. We need the water. We need the power. And we are glad that we see a lot of conviction. The government of Uganda has prioritized maternal health, and it has put it as one of the key indicators within the Human Development Index, and what will help us move this country from where it is to a mid-level income country. We want to thank each of us, and we pray that you will continue with this advocacy and real work on the ground to make sure that we are coordinated and doing what we can within our sectors. The teachers in the Ministry of Health, I think now we have somebody who was here, and actually he came from education now to advocacy for health. Advocacy for health, and particularly in family planning. Isn't that wonderful? Because I think his thesis was on adolescent girls and why they continue to have problems in Mukono district. And so he's taking this to a higher level to make sure that no adolescent girl gets pregnant when she's not ready for the pregnancy, and that family planning is strengthened in this country using what he already learned here. Still a teacher, but he has been assimilated into another sector. I want to thank you all and continue to encourage you to reach higher and higher, because many of you can do greater things. I don't know whether today we have some members of parliament. Yes, because I think the members of parliament have done us well. Those who have articulated themselves on maternal health, you've indeed allowed for the government to identify specific budgets for maternal health. Probably our colleagues are able to do better in the health facilities because the resources they have to use are actually more readily available, and infrastructure development is taking place. I want to encourage our members of parliament to continue to be there so that bigger budgets can be approved for maternal health. We are as selfish as this. If the budget is not seemingly highlighting how maternal health will be addressed, please don't pass it. Because the biggest burden we have of ill health so far in Uganda is still perinatal and what? Maternal. And we want to see more investment in conditions that will help our mothers to survive. I want to once again welcome you, all of us who have made it this morning. With the blessings of God, the rain has moved us from wherever we were up to here. And we are glad, all of us, to be healthy and safe in the Uganda Christian University. The leaders at the university, we can't thank you more. Maybe if this hadn't been housed here, we wouldn't be counting the 19 years. Thank you. Thank you very much. I now have the opportunity to move to the next step of taking you through what is available from our alumni. So I want to have support so that we can start in time. Thank you very much.
Okay, thank you, Dr. Olive Sentumbwe. Very, very exciting. And we should give another hand clap to the Lord. Imagine 19 years, and the founders of the program are here to witness such a day. We don't take it for granted that we still have life, we are still breathing. So very, very exciting. As you realize we are quite a number, we are going to divide the room in half. And Dr. Olive will lead the team as we start to look at the exhibitions to my left. And then my supervisor, Professor Pius Okong, I know that you will be our keynote address speaker, but now sometimes you also decide who it is that you can quickly delegate. So I don't fear delegating my supervisor. I'm here because of him. You will lead the team to my right. Thank you so much. So let's get moving. I hope the exhibitors are at their stations so that you can quickly take us through what it is that you have. We know we have an online community. You're very, very welcome. We haven't forgotten about you. We are in the era of technology and we are maximizing that. You're all very welcome. And let me see, I know that we also have the area MP for Wiaga, Kagadi District. Where are you, Honorable Musana Eric Achali? Yes, at the back. Thank you so much. Thank you for honoring our invitation.
So I invite the USA and Canada Save the Mothers chairpersons to join me on this room. Thank you.
So we just study under our program and so it will be running in 9 districts and one of the initiatives where we have
Testing.
So we also, So we are also in charge of this program here in East Africa, but we provide support to all organizations that are implementing activities in family planning. So it's also supported by the USAID government, by the USAID. These are also different studies we've done on how to improve uptake for maternal and child health services. And with this, we provide e-vouchers to our mothers in Kweni, Buko, Namaingo, Bukedi, and Bali and Kalangala to ensure that they actually receive services free of charge, and we are able to track them. This is our annual report for 2022. So if you have some time, you can pick a copy. AMREF also was among the organizations that supported community health workers in tracing and tracking COVID-19 disease to reduce the contacts in the communities. So we developed a guideline that has been used across Africa. We also have a unique program that is the Flying Doctors Services, where we do emergency evacuation. And most of our emergency evacuations are for mothers and of course, people with illnesses like cardiac arrest. So we work with all the hospitals in this country to support Ugandans access care where we are not able to give it in Uganda at a very subsidized fee of $50. You're flown out of the country. So we encourage you to all come and visit us and see the work we do. Our new innovation in the program is a kokono crib. Kokono is a Ghanaian word meaning a half of a pumpkin. I don't know if you know how pumpkins look like, but in some countries they are so orange. In Uganda, they are a bit green, but when they cut it and scoop out the food, what remains is what is called a kokono. So this is an innovation to protect newborn babies up to the age of 1. And it's a biodegradable crib made in Uganda. We are in partnership with Mukwano Industries. And it is an innovation through an organization called The Lab in Italy. And they are testing it in Uganda. So we have distributed these cribs to about 1,000 teenage mothers across the country, especially those that got pregnant during COVID. And what we want is to enable them go back to school, but also be able to leave their babies with guardians, and they are protected against mosquitoes and any other illnesses. We also give it to young mothers who are working, especially in informal settlements. For example, if you're driving in the morning, you'll find mothers on the roadside trying to sweep the streets. And many of them, especially in the urban slums, we've provided them with these cribs so they are able to go with their babies at work. They don't carry the baby in that crib. You carry the baby, but when you reach somewhere, you put it somewhere and protect your baby. We discourage them carrying the baby in the crib because it can easily tilt and things like that. It's totally biodegradable. The mattress is perforated. The mosquito net is treated and distributed by Ministry of Health. And it was approved and shared in the Ministry of Health technical working group. So we hope that we'll be able to distribute it to more mothers as we continue getting partnerships. The cost of that crib is about $30 if you're to buy it. But what we do, we have given it as an income generation component to the community health workers or the VHTs. So when they go door to door, they are able to encourage mothers to use it, but they can also get an income of about 50,000 shillings
from their families to enable them continue doing the work they do, because we know they are volunteers. So thank you. That is it from Amref.
No, just say it's really great work. Thank you so much, Amref. Especially, I think, alluding to what Dr. Oli talked about, that neonatal mortality is a big issue. So seeing this innovation where at that very delicate time, the baby is having to be kept warm, safe, free, I think it's really a great innovation. Thank you.
One thing also we've seen, especially in the urban slums, babies always share with the adults.
Yeah.
And that's where they are getting the hospital bites.
Yeah.
But with this screen, if you go down to Katanga, almost every end has a crib, and they are able to have the babies separately. And it's also, it becomes, sorry. Okay, oh, so sorry. What I was saying is that for the crib, we have really distributed it to the urban slums like Kawempe. If you know our area, it's waterlogged with a lot of mosquitoes and the hygiene is a bit wanting. But what we have done is to also support babies be able to sleep on their own. As you know, in our communities, many mothers share with babies, but we've also had teenage mothers who have suffocated their babies while they are sleeping because they are young, they don't know how to care for their babies. So we've distributed this in almost all the households, and we've seen a lot of improvement. We hope by end of year or next year, we'll do a research sharing the results of how this has protected babies from malaria. In Uganda, a treatment of malaria is about $20 if you don't go to a public hospital, and most of these communities cannot afford that, but we know it's the highest disease burden in our country. So we encourage you to also really support us and share about this crib. We are always ready to share the history, the information about it, and we want more babies protected. Thank you.
Thank you. You're welcome to this table. I welcome you all. My name is Peter Olet, an alumni of 2018 international class and the class president of that year. In the previous year, we had a presentation on a local initiative for health financing in a hospital. And here again, we are to give the feedback of the local initiative. And you could remember about the chicken project. This is the Peter who championed in our rural area of northern Uganda, in the Yam district. Having been the administrator of the health facility level 3, it was quite hard for us to source for any other donation to improve comprehensive quality of care of health services in that community. And so introduced the idea of using locally available materials. And we realized by engaging different stakeholders and our community, they were really willing to contribute within their means. So the best option was to utilize what is available in their hands. And we realized that every household could at least afford chicken. And here was the point of entrance. So we started the construction of a theater and a general ward capacity of 55 beds. And this year we have managed to roof the structure. We have managed roofing costed us Uganda shillings 41 millions. And altogether it has costed us 100 plus Ugandan shillings. We couldn't imagine this could happen in our rural community. The will is a lot, and we realize there's power in mobilization. Power in mobilization. So as we see now, you can imagine our engineers, you may not believe they're the ones, but these are the guys behind the big structure. What is remaining is the completion of this structure, which is about $22 only. And given the fact that any advocate, any willing person among the team or elsewhere is able to contribute this $22, then in the next 12 weeks, we shall be done with this structure. $22 only, we would be done in completion of this structure. And so we shall have more mothers and babies saved from dying out of complications or any avoidable death that we can't really avoid with our mothers and children in our community. I thank you for coming, and I welcome you for any question and any concern. We are there to use local approach. This is what we are doing. Thank you. Any question or comments?
Thank you for the community mobilization, which has really led to a huge impact in terms of improving the infrastructure within which mothers deliver. Because infrastructure usually prevents mothers from coming in. Because in some communities, they are seeing that there is no difference between where they are sleeping and where you are asking them to come. So this is very important, and coming from the people themselves, community ownership, something we are all advocating for. And I think you will be able to continue with even greater things to integrate within what you've already achieved. We want to thank you, and we want to thank you for realizing that the community has power and indeed will change their own situations.
Thank you.
Thank you.
Thank you so much. I wish you well.
You're welcome. Good morning. I'm Rachel Vavide from CDFU, Communication for Development Foundation, Uganda. We are also here to share with you some of our products. CDFU was established in 2002, and we've been in existence for 20 years. And we do SBC services, social behavior change, and we work with different partners in providing these services. We work with health facilities, we work with local leaders, and many others, because our services are more of health, that is family planning, gender-based violence, maternal, and we do also have a product of a call center where people do call in and they are given information and counseled, and referrals are also done since we work with other people, because there are some services we can't offer online, like treatment or examination. So we always work with other people on ground that can go ahead and support our mothers, our people, to get more services and better improved services. So as CDFU, we work with different projects. We have different projects on board that we work with to provide those services in the local communities. For example, in the places of Buyende district, Kamuli, when it comes to SRH, and also in the places of the north. So our call center is one of our products as CDFU. Apart from the call center, we also have Rock 0.25 as a drama, and in this drama, mostly we do sensitization. It's a drama, but sensitizing people about, for example, their rights, what their responsibilities, and when it comes to leadership. So it's more of empowering them in the communities they stay. So being that most of the times, our adolescents especially, they find it hard to do consultation. It's the reason we introduced the call center for them to call in and inquire. And as well, we link them to the youth corners where they get services at a friendly, in a friendly manner. Yeah. So that is CDFU. Among the products, we have the projects. We have the Nietu project. I don't know if you ever heard about it, in the districts of Buyende, Kamoli, Kampala. And that is, we do sexual reproductive health, mostly among adolescents, because we all know adolescents, and when they are growing, the milestones they find. So it's the reason we have that on board. And we also have Make Happiness, Not Violence, where we do support mothers and all people when it comes to gender-based violence. So in this, we link them to people where they can get the necessary support so that we end violence, especially among women and girls. So we also have other projects on board. Since I was given 2 minutes, I'll not be able to explain all of them. But among the products, as I've told you that we have a call center that works 24/7, and then the low point drama that sensitizes people, among others. Yes. So you're all welcome. In case of anything, we are always here to serve. You can call our toll-free number. In case you have questions, it is always there, and people are there to support you in the different languages. It's not only English, we also have other languages. Ngakarimajong, Leptul, all those people are supported in their local languages. Yes.
Thank you very much. Any questions, any reactions to our colleagues, CDFU, and their communication agenda for the young people and for preventing GBV?
Yes, thank you so much, CDFU. We recently visited CDFU because two of the people, the top management there, are alumni of the Mother Baby Friendly, of Masters of Public Health Leadership Program. And it was amazing to learn that actually, on top of the people who speak very many languages, who link people to the services, they are planning to bring a midwife on board to be able to answer simple questions regarding prevention of pregnancies, family planning concerns, and I was excited about this. So we thank you so much, CDFU.
Thank you, CDFU. Thank you very much. I hope you will also work towards talking to men about the prevention of violence and pregnancy. Yes, male involvement is going to be critical.
We
for
do,
us.
but why, most of the times, women are more at risk.
Yeah, they are at risk.
Yes.
Of who? Of who?
So what we do, not only talking to women, there are cases where we have to call the two bodies, and we talk to them. For example, as I told you, if a lady calls reporting a case, you don't listen to the lady and then conclude on that. So we always also bring the man on board so that we see how to support the couple. Because the goal is to see the couple living happily. Yes.
Thank you very, very much. Okay, colleagues, we are going to the last.
So this is our
second last. Okay.
We do have, this is the second last. There is Mbale People's Hospital over there that we will move to after here. You're very welcome to the Save the Mothers stall. At Save the Mothers, we pride of two superpowers. Our first superpower is a master's in public health leadership. And it is a superpower because it trains leaders to save lives of mothers and babies. And you know what that means. Leaders who are multidisciplinary professionals who are gathered here today So that is one of our superpowers, and we invite you to share the information about the Masters in Public Health Leadership for others to enroll for our September intake. You're welcome to the Masters in Public Health Leadership. It's currently an online program. So you need to simply come on campus for orientation for 2 weeks and then go on to the online platforms to continue your studies. That's why it's very attractive for working people like you. Then we have our second superpower, the Mother Baby Friendly Hospital Initiative. This looks at the third delay, where we work in partnership with over 14 health facilities in Uganda to improve the quality of healthcare in the maternity units. So we work with them to identify the gaps, and we work with them to identify the solutions and then address those solutions together. And we have, this superpower has alumni who are advisors attached to each of the hospitals. And the alumni here today, we invite you to join the advisors. Let's keep this conversation going such that we get you on board on that superpower, the Mother Baby Friendly Hospital. I see that there's someone here today from the Rwenzori region, where we have one of the Mother Baby Friendly Hospital initiatives. Some of the things that we do there is set up high dependence units in the maternity wards, such that critical mothers are well taken care of, monitored very, very closely. We have a mother here who says, at 26 weeks of pregnancy, I got admitted to the maternity HDU in Mbale Regional Referral Hospital. I had severe preeclampsia. My whole body was so swollen, right from the face to the feet. I could not be recognized. I was also bleeding severely. I thank Save the Mothers for setting up the HDU that saved me and my baby. So that's what these superpowers mean. And when we say they are superpowers, you know that each one of you who is alumni here, a student, you're doing a lot of work to save the lives of mothers and babies. Thank you so much. After this, you can feel free to come here and take a leaflet that you can share with others. Thank you. So we can move on to Mbale People's Hospital. Okay, Mother's Heart Uganda has just arrived.
How are you? Good, good, good. Yes, Rebecca. Nice meeting you again. How is work?
Mother's Heart Uganda.
Thank you for exhibiting.
Into action.
Good morning, everybody. I'm called Jeremiah Mbramani, an alumni of Save the Mothers, and I'm happy to be here for this conference. I'm also delighted to see that after doing my course in 2012, I was able to graduate, and I did a research on the utilization of maternal health care services amongst women of the reproductive age. And after my graduation, I went and mobilized community to see how best we can improve the maternal health in my community, Mutoto. And I founded Mother's Heart Uganda in 2016. Basically, we are focusing on health, education, and empowerment. Currently, we have Golden Hill Junior School, where we have enrolled 302 pupils from kindergarten to primary 7. And we had our first sitting for primary 7 with 8 candidates last year. We had 3 in grade 1 and 5 in grade 2. We also do health-related programs in advocacy in the community related to antenatal care access, encouraging mothers to go and deliver in the hospital, and also to respond to emergency obstetric care services. And now we have also extended our services to curative. And we have a small facility where we are giving basics, and where we find complications, we do a lot of referrals. We have a community ambulance. We use a tukutuku, and it is very, very working for us in the community. We do a lot of empowerment of the women, the youth, and the men. And I'm proudly happy to inform you that through those empowerments, women's economic empowerment has really come up with good products. As you see in front of me, these are some of the products that are being made by the women in our community. And I've sent regards to everybody in this conference. And through my friend, Sama, she wishes maybe to say something from Mother's Heart Uganda.
Thank you so much. I'm really happy to be with you today. And I'm really grateful for the experience that I get it with Mother Hearts. Those ladies, they were very inspiring for me. I learned from them a lot, and I was very happy to join the Mother Heart recently. Thank you so much.
So participants, I'm happy again to say welcome to Mother's Heart Uganda. If you have time after the conference, you're welcome. We don't have gates, no cameras of surveillance, no dogs. So it is free entry and free exit. You can come and share with us your experience. You can also take the opportunity to support a woman in my community by buying a product from them such that they're economically empowered. Thank you very much.
Thank you, Jeremiah. Really for coming down to address the factors that actually bring about the issues which we are seeing in the health facilities. And empowering women through education and economic empowerment is really going to be the key saving issue in all our communities. So we want to thank you because this is really practical. The women become more confident. It's very inspirational for the families that we stop to talk about, I wasn't able to get a bus, I wasn't able to do this. You have even got a community ambulance service, you know, to make sure that the women are transported in time to the health facilities where they need to be. We want to congratulate you, and we are also sending greetings to these great women. I do believe that we will be able, yes, to take these handbags and the crafts that you have. And thank you for passing on the skills. You have that opportunity to make sure that the younger women and the younger men are getting these skills to make sure that they are supporting the families. Thank you very much. Some comments?
I think honestly, I know there are lots of faculty in the meeting today, but as a former faculty and a faculty always of Save the Mothers, Olive used to be in the classes and talks about social determinants of health. And I think to really see that the lectures of social determinants of health have translated into change projects where you're giving the women that empowerment. I mean, if I can make a bag and I can sell it, then I'll not wait for my husband to give me transport. To just be here and see the alumni and how much you have done it's such a rewarding experience for all of us who stood in class and gave the lectures. So honestly, just thank you. You just make us so proud, and thank you so much.
Thank you very much, German team, Mother's Heart Uganda. We'll be there, yeah. Okay, I think we move to the hospital. Hospital. We move to our next station. Yeah, vale, yeah. Yes. Okay.
Praise the Lord. I'm very happy for this conference. By the name, I'm called Apio Janet, alumni of 2016 international class. On the behalf of Edison Arwende, alumni of 2012, I've been sent to present this. This is called SCOAD. We are located in Bugiri district. This is simplified call for the real empowerment. So we empower younger girls and also boys to make their own income generating activities. So we train them how to make their own clothes. These are skirts. We also train them to make their own cards that are reusable. Sometimes they cannot be able to afford, so they can make for themselves and also for sale to get some income. We also train them to make the baby shoe in a local way. It was not yet, but they are still making it. It's just a sample, at least to make the baby warm. For more details, you shall see from the flyers. Since I have been sent, I will not talk much, but I want to thank you for all this organization. That's
Thank you. Thank you. We really want to thank you and your colleagues who have been able to put this together. You are indeed speaking to the needs of the mother and the newborn. Yes. And we can only encourage you to do more. Thank you very much. Any other comments to the team? Thank you. And the girl child, they are also doing great things for the girl child and her menstrual needs. Yes. Thank you. And especially if you are in Wujiri, thank you very much. Amen. Okay. Okay, we are here. Okay.
Thank you so much. I'm Canon Arboboa Zimbagaya, class 2010-2012. When I joined this institution for this program, I was coming from the medical background. I was one of the students that was majorly stressed by the demands that were coming from my fellow students, because much of the attributes was towards the medical setting and then the government. But I want to thank the lecturers that put it to us and said, you are the government. So when I discovered that I'm the government, then I asked myself, what am I doing in the government to change this scenario? So immediately I picked my project proposal that eventually became my thesis, the role of the community in improving facility-based deliveries. I want to thank Dr. who was my my supervisor. And I went into the community and I found very many challenges. But my concern was we should not always depend on the government. Then we started an NGO called People's Life Care Foundation that purposely was to organize local resources through different mobilization to start a hospital, which is non-for-profit, to give the community an alternative, that this is the government, but also this is the private. Then, can you take a choice? Now, our duty was to go into the community and sensitize the community to understand that you need also to save for delivery. In my research, I found people had capacities to develop themselves, but they overlook at them. So my challenge was, what do we need to do with these capacities? They are saving for food, they are saving for school fees, but when it comes for delivery, 9 months, nobody's caring. But when an accident comes in an ad hoc way, they mobilize resources immediately. But by the time they reach the hospital, then there is a problem. So we started also mobilizing mothers, and I used the church platform to ensure that they save some. The moment the mother gets pregnant, we use the benchmark for VHTs. So we formed the home cell care mothers group to be mobilizing mothers within the home cells, and save 1,000 shillings. It was 100 shillings in a bottle. And after every week, you go to church and you mobilize your resources and you keep. And that money was used to go into the villages to ensure that when a mother gets pregnant, you have to attend antenatal. And if there is any need for you to go for an scan, if there is any complication, then they pick out of that money, they take you to the hospital. And we use it in the Eastern region, in Mbale Diocese. It covers 8 archdeaconries, and it was very successful. And during that time, we also constructed Mbale People's Hospital as a referral hospital, as an alternative for those that think the government services are very harsh, nonsense can beat you, you can be neglected. So, yes, we have had a breakthrough, and mothers, they come, and the most important thing is that we don't mind whether you have cash or you don't have cash. You can pay in kind. You come with your Coke, you come with your beans, you come with your coffee, and then we quantify it, and then we deliver you. Then at the same time, we have an ambulance. We want to thank the Rotary Club of Canada Motor that contributed ambulance to Mbale People's Hospital, which we use to take the mothers and also pick them whenever they have a need. We want to also save the mothers that partnered with us in ensuring that we cater for HIV pregnant mothers. Save the Mother gave us small grant that we partnered with us, and we are looking after pregnant HIV positive mothers. You go into the communities, we partner with the health centers, and when they come and access ARVs, they come and access health other services, which they get indications for cesarean section, they get cesarean section at free of charge. So we want to thank God that this Save the Mothers provided us an opportunity to go into the community and serve. You are most welcome.
I think we want to thank the colleagues from the Life Care Foundation Uganda, a complete hospital, which is helping mothers, and all the initiatives that they are having believed in themselves, that they are now government, and they are going to provide what? Services and make them affordable to the communities, and sort of introducing systems that help people to believe, to use what they have for better health. I think this is very wonderful. And you need to write your experiences and, the achievements you are making, and make sure that other communities learn from what you are doing. Surely. I think we are very grateful to God. The things that we've gone through show that the hand of God has been with us all. And we are very excited as alumni for the wonderful things that you people are doing in the community. Yeah, we give thanks to God.
Project here next.
Thank you.
Save the Mothers East Africa. Yeah. So you have the flag of Tanzania. So you need to hear what's happening in KZ.
Hello, you are most welcome. We have come here all the way from Tanzania. First, to thank you so much. We thank the mothers, Dr. Jane, Professor Pius, Dr. Mukoza, Ivu, and all alumni and all other guests of honor, that what you taught us, that no mother should die. It really has brought a different change in our country. Story comes when I was working in another place. When it came to another place, Pwani region, it was 2019. I found the maternal death was 26 per year. So I said, coming from UCU, save the mothers, how can I bear it? So we have to bring the data to analyze what really the cause. We found that 75% was due to PPH, severe anemia, maybe ruptured uterus, and so on, but dealing with the blood. So we came together to say, what can we do? So we came with this beetroot. I hope Uganda you have it. Okay? So this one has saved. So we said, from our country that 8.5 gram per deciliter, 8.5 gram per deciliter is low HB. But for us, we said from 9. So we distributed all facility. If you get the mother, it's 9 gram per deciliter. Give her the information that we are going to have a workshop with her. So we started the workshop. We bring this on the table. We show them how to wash, how to make a juice. And the juice we make from the beetroot, a little ginger, and a lemon. So we started the first group. And then we continue every Saturday we are doing it. So coming to 2020, from 26 maternal death, we came to 11 maternal death. Yes. So 58% was reduced. 58% reduced from 26 to 11. So we continued. The mother were very excited. After 2 weeks, who has 7, it is 9. Who has 9, 11. So from 7, they come to deliver, we are having 14 gram per deciliter, 13 gram per deciliter. So, if you have a high HB, also the coating factor is high. So even if there is bleeding, if the coating factor is high, so you have a good position to save the mother. So we came to 2021, it was 9. 2022, it was 8. Last year was 6. So last year we can say we have reached to 77% reduction. So we are hoping this year we are continuing that we want to reach to 0. Why not? Want to reach 0. So this beetroot, because we said, we just wash it without peeling, then you blend. Like this one, you use a bit of like a thumb of ginger. Then after blending with 1 glass of water, then you squeeze the lemon, 10 mils, you mix, the mother drinks morning, afternoon, and evening, tedious. Even after 5 days, the blood have to be increased. We went to TBS, Tanzania Bureau Standard, they found that there is a lot of magnesium, calcium, potassium, and iron. And now we are dealing with a chemistry that now we have to make sure that we as Africa, we can prepare our own things. This one we are digging ourselves. Then the mother, they can use it because it have magnesium. So it means it will reduce also the eclampsia. Because you understand, if the first will not be a PPH, the second is eclampsia. If eclampsia comes first, PPH comes the second. So using beetroot, we will beat it twice, PPH and eclampsia. So for us, we have done, and we are continuing doing it. Even the government has known it. We have a journalist also has announced to the people. They phone us from every place that we have seen you doing this thing. Can you explain to us? So we're explaining to many people how we can make it and how we can reduce the maternal death. So in our place, Kibaha, we've reduced and such, even our region, even our country. This time, the maternal death has reduced. Thank you.
Tumekuja kusema asante. Tumekuja kusema asante. 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 Tumekuja kusema asante.
Save the best for the last. Thank you very, very, very much, colleagues from Tanzania. Indeed, in the spirit of East Africa, I think we are sharing great things. And this is nutrition for maternal health. Thank you. Thank you very much for sharing this information with us. We hope you will send us the write-up about how to prepare so that we get it right, the formula we need it correctly, so that we don't make any mistakes, and we can also begin to talk in our antenatal clinics. I think this is a huge success for us and for the mothers that we represent. Thank you very much. Asante. Yeah. Thank you, colleagues. Any questions for them? Nutrition and health? Thank you. Yeah, there's a question here for you, colleagues.
Hello, thank you so much. I just only have one question. Like, it lifts up the blood level, but in most cases you find like when somebody is going to menopause, there is a time when they lose a lot of blood, they get like dizziness, blackouts. Can this one also still be used? Thank you.
Yes, it's not only for maternal. Anybody can use sickle cell. We have used a lot for the sickle cell children. If they use this one, that one attack reduces so much. For the older, the people with cancer, you know when you go for chemotherapy, so many cells comes down. People with dialysis, this one also helps so much. If you have person with dialysis, you have to use this one. You have a patient with cancer, have to use this one. It saves a lot. And if somebody not having a blender, you can use this one. When we are teaching, we have to consider your population. If the population is down, you show this one. We just scratch from here and the ginger, then you sieve and put water. If nothing, can use even what? Pounding it. Yes. So anything you can use according to your population, which you are trying to educate. Thank you.
Thank you very much. For nutrition for health. I think we can take our seats. Thank you. Thank you very much for first round. Thank you, Tanzania.
Okay. Welcome back from the exhibitions. Thank you so much, Dr. Olive and the team. If you can hear me, raise your right hand. If you can hear me, raise your right hand. Then I will know that you're with me. If you can hear me, raise your right hand. Obed, if you can hear me, raise your right hand. Yes. Okay. Thank you so much. The first lesson learned from this segment is that you can never organize an exhibition for 15 minutes. So take it away as an unintended benefit if you're planning any event, that you can't have an exhibition for 15 minutes. And Team Mbale, rather Team Tanzania, happy to hear that you're in the room. Can you please stand for recognition, Team Tanzania? Where are you? I had somebody from Tanzania. Team, yes. Wow, that's how they do it. Team Rwanda, show them that you have yours that is even more fun. Yes, that's Team Rwanda. Team South Sudan. Team South Sudan, you're very, very welcome. And of course, the host, Team Uganda. Yes, this is the East Africa team. Yes, we called Team Rwanda. So you missed seeing him standing up. Yes, we called him out. Yeah. This is the East Africa Save the Mothers program, and we want to just welcome the people that really traversed the lake and the oceans to come and add to a global experience to the East Africa community. And before we go into the next segment of our drive to the renovation of the Mirembe Hall, I'm going to invite the team from Triple P to come and give you a bit of entertainment, because Triple P also belongs to an alumni of STM. You're welcome. A better hand clap. Yes. The young citizens, those are the leaders of tomorrow. All of these were born when STM had started. Isn't it amazing? All those are lives that were saved. Yes. We have on the next segment, what we have are oral presentations, but I have an advocacy background, and I was told that if you have a day to speak, use it. But if they gave you a minute to speak, don't lose that opportunity. So use the time according to what it is. So I'm going to invite Irene Nakamate, Tembo Tseravano, and Rogers Mandu to come to the front. And I know you could have prepared, but get ready. My background is media, and I'm also a coach. So I will simply ask you some quick questions. These were your interventions, so I am sure you know what interventions you carried out. You know the problem that you are solving for. Just come and educate us without a script. You're welcome to the front. Irene Nakamate, Tembo Tseravano, and Rogers Mandu. Okay, do you want to grab some quick seats so that I don't, yes. So give them a hand clap to ease that, yeah. These are people who did amazing, amazing stuff. For the people in the control room, please, we are not going to run all the slides. I'm taking charge and trying to redeem a few minutes. And I'll start with Irene, since I see your slides are up, to just have a sense of so all you're going to share with us is, of course, you tell us who you are and what it is that you are working on and what are you celebrating as a result of your intervention.
My name is Irene Nakamate. I did a research last year from March to June on the effect of an individualized rapid assessment tool on knowledge, attitude, and practice of healthcare workers regarding management of medical waste. And this was a quasi-experimental study that was piloted in two health centers. And the results were very significant if that tool is used in the management of medical waste. Basically for leaders to train healthcare workers on how to use that tool, and because it gives measures, prox scores at the end of it when it is used. And it also encourages those people in the leadership role, the administrators, to provide the requirements for management of medical waste. Because you find in many health facilities, healthcare workers would love to manage medical waste, but because they don't have the bins where to put that medical waste, they don't have the gloves, they don't have whatever they require, even the posters to remind them are not there. But this tool was really very, very effective, and the knowledge, attitude, and practice increased.
Okay, Irene, thank you so much. Share with us a little bit about the tool. What is it about the tool? The bins I can visualize, but I hear you talking about the tool seemingly working minus the bins. I'm just trying to understand how that works.
The tool is not here in the slides, but it basically has two major parts. Part one focuses on health, on the leaders financing the project of medical waste management. And then it also talks about the safety and health hazards that health workers could get when they are managing medical waste, but it also emphasizes training of our healthcare workers regarding that and many other things. It also has key questions on color coding of medical waste. Are healthcare workers trained in this management of medical waste? Do they know what coding is? Do they know what segregation is at the point of generation of waste? Do they know how to deposit this medical waste financially? Lastly, as key questions, that is the tool.
Thank you so much. I believe we all know that medical waste is something that we need to be addressing, otherwise infection rates can go high and it can deter all the work that we are trying to do. Next, Tembo, share with us. Yes, a hand clap for Irene. Tell us about what it is that your name and of course what it is.
My name is Tembo Silvano, cohort 2014 international class. I come from Kagadi district. I work in disease surveillance in DHO's office. And there's a place called Ndaiga. It is hard to reach according to our district because accessibility in terms of transport reaching there is not easy because it's bordered with serious escarpments. And one time, we realized when we were making performance reviews for these facilities, an indicator of antenatal services was at 0. And I said, how does it happen? When I looked at the population of Ndaiga, we were expecting 528 mothers per year. And I said, these mothers are going without antenatal health care services. I moved to the community. I met the leaders. The place is made of 8 villages. So I had to meet all the 8 LC1 chairpersons with the VHTs, and we discussed how the challenges that they are facing in terms of maternal child health services. They said, we are not accessing any antenatal, we don't see anybody there. And the reason is, the facility is a health center too, and there is no midwife in that facility. So those people go without any antenatal health care services. But for those who want to manage, they cross to Ntoroko using a boat, that's another district, or come to Hoima through the lake via Chukube to get services, and that is costly. Now, we sat with the chairperson LC1s and we agreed that let us meet the pregnant mothers and we hear from them. And when we met the pregnant mothers, we discussed how they can make sure that they access health services using their own resources. Because first of all, the place has an escarpment, the motorcycle doesn't reach there, even though no vehicle reaches there, it only accesses, the vehicle only reaches the facility, but not the villages. So the facility is at the side, or at the end of the villages, but the rest of the villages are at the islands. So we agreed that the chairperson S1 said, we can provide a boat and an engine without fuel. Then the mother said, now that is costly, we spend like 20,000, 30,000 to go and get a service. Let us contribute to fuel. Then we asked the chairperson of the S1s, how much fuel do you need to reach that facility in case we make it an outreach? And we agreed that we shall get a midwife that we shall be going with, and we make it an outreach. So the mother said, the LOC said, 5,000 is enough to put them on a boat, take them, and bring them back. Then we started in October. It started, they collected the 5,000 because it was cheaper. It's like now 2,500 going and 2,500 coming back. So 5,000 was cheaper for them, and to move as a group, because one person cannot do it, cannot make it. So that's how we started, and they have been coming to the facility as a group. So what we have achieved so far is that we have now conducted 5 outreaches since we started. And the number of mothers getting ANC 4 has improved. Now 58 mothers have received ANC services 4 times. And remember, we started some of them, others were about to deliver, others were in 4 to 6 months. So, but those ones we started with that were at 12 weeks, those ones have completed at least four visits. So that's so far what we are doing, and the program is still continuing slowly by slowly. I am moving with them slowly by slowly. After getting used now to ANC, then the next step we shall see, now how do you deliver and where? So that's what we are trying to move slowly by slowly with the community so that we don't wait for other people to think for us. Thank you for listening to me.
Thank you so much. Clearly, you can see he's addressing the delay to access services as well, had to reach areas. You've done well. And I think the key message I pick from that is the community involvement, starting with the leadership. The communities have answers, especially if we are able to engage them. So another hand clap for the Ndaiga community. Yes. Rogers, over to you.
Thank you very much for this opportunity to share our experiences of implementing a collaborative network amongst hospitals in Busoga sub-region. This study was done both in Uganda and Kenya, but we'll limit ourselves to the Ugandan context. Basically, this was a way of trying to bring together a network of hospitals within which they could be able to contribute to a reduction in preterm mortality. All of us are aware that the leading contributor to neonatal mortality is prematurity, which has lately been ignored until a call came to us that we can do something to be able to reduce these numbers of mortality amongst children below 5 years. We had an intervention in Busoga sub-region where Jinja Regional Referral Hospital was at the epicenter of championing these initiatives through the support of Makerere University, the School of Public Health. And these hospitals were brought together to be able to compare and share ideas amongst who has performed best using a quality improvement model by asking 3 fundamental questions of what are we trying to accomplish, and then what changes do we make that can lead to improvement, and then also how do we know that a change is an improvement. A lot of work has been going on, but it went undocumented. And in health, we say that what is not documented is not done. So a lot of effort was wasted. We started by engaging the teams through data strengthening initiatives using a modified child checklist. Modified in the sense that issues of prematurity had been ignored even in the documentation. Little was documented about prematurity. So we started by identifying areas of data where this data is available, and where not available, how can we ensure that all the data is captured? We introduced a number of indicators. One of them was using the antenatal corticosteroids, and in this context was dexamethasone. And we realized that at each of these hospitals, dexamethasone was only administered on the recommendation of a doctor. And yet, identifying preterm labor was also a challenge. So the teams were able to work out areas of improvement by identifying some of the solutions, local solutions, because in most cases, local problems require local solutions for them to realize a change. And that is why we ask, what changes can we make to be able to make a difference or an improvement? So people came up with, the teams came up with different change ideas. I don't know if we can run quickly to one of those slides so that we can just visualize some of those change ideas, like identifying preterm labor at triage area. So Most of these mothers could even end up at the delivery point without being identified at triage that they have preterm labor. And therefore, if preterm labor is identified, then we are able to administer a corticosteroid to guarantee a better outcome of the baby. Those are some of the change ideas that we ran through, and some of them have been approved. Even as we speak right now, these are being practiced at the regional hospitals in Busoga, and these hospitals were Jinja Regional Referral. We had the Kamali General Hospital, then we had Iganga Hospital, and Buluba, St. Francis Buluba Hospital as the intervention hospitals. But later on, we went to other hospitals which were trying to act as a control to try and compare if the intervention dose given to these other hospitals makes a difference from the others. So in a nutshell, I want to say that the quality improvement aspect of ensuring that documentation is done from the start, using clinical mentorship, hands-on training of the frontline health workers within a collaborative ensures that the quality of care improves because there will be some form of competition, but there is also peer-to-peer learning because some of the mentors were drawn from within the hospitals, although we had a mix of other mentors from the national and even international forums. But we have observed that prematurity has reduced because we have measured this using the pre-discharge status of the preterm babies. Prematurity, preterm deaths have reduced in the region following the trend of the documentation that we have observed. Thank you for the opportunity.
Thank you so much. Local problems? You say it like you listened in. Local problems? Yes, that is what our graduates are doing, that when there are problems locally, you need to engage the communities and come up with interventions that are meaningful for them. As we think broadly about the conceptual framework and interventions, we have to grow local. You know, that's what we normally say. You start global, localize, and community intervene. Thank you so much. Please ensure that you network with these people to learn more about the interventions. Thank you so much. You can head back. Yes. And while we are in this place, the chaplain prayed for us. Other people also welcomed us into this place. But we need the hosts to actually welcome us. So Dr. David Mugawe, who is also a board member of the STM East Africa, is here to represent the Vice Chancellor and welcome us into UCU. You're welcome, Dr. Mugawe.
Yes, good afternoon and praise the Lord. I'll recognize protocol in a concerted way. Our chief guests who have been invited to participate in this conference, the different boards that are here, the Canadian board, the US board, the Save the Mothers, East African board, distinguished scholars, friends, ladies and gentlemen. It's a joy for us as UCU to witness a conference like this. It gives us a very, very special flavor. As you know, an institution of higher learning, like a university, is required to participate in three apexes of a triangle. One is for us to carry out teaching and learning, which we all do. The second one is for us to participate in research, which is happening. And the third one is community outreach. And as a university, we're required that we are active in equal measure in each of those three. We had a council meeting last year, and in our presentation, there was an observation made that as Uganda Christian University, We are strong in terms of teaching and learning. We are growing in terms of research, but our community outreach was an area that needed to be strengthened. And in that council meeting, an example was given. Why don't we do more Save the Mothers? That's how it was presented. Why don't we do more Save the Mothers? So which means that Save the Mothers has distinguished its identity in this institution. That it's a model that we recognize, we replicate, but also it's got its uniqueness. There was also an example given and said that as an institution, we are as good as our graduates. And the examples that were given that follow that statement were Save the Mothers graduates. And the person who was speaking had attended the previous conference. And he said when he came here and he walked around the different displays and listened to what was happening out there, he said, this is what UCU should be about. So friends, we're here to celebrate something that is not only academic, but something that is impacting and transforming society. And all that we do academically is empty unless it touches a life, unless it touches an individual, unless it makes a difference, unless it causes a smile. And today is a conference, but also a celebration of what Save the Mothers has attained. We are marking 20 years next year. And as Uganda Christian University, we are honored that we were selected to be the host for this excellent program. And it comes as a celebration, but also as host is leaving a challenge to us. Have we achieved what we promised to achieve in the last 20 years? It's a point where we want to evaluate ourselves. That when you talk about Save the Mothers, when it is established, with all the clear milestones, have we achieved that? And if we look at that, there'll be areas where the tick is not given. And that's our takeaway as Uganda Christian University and Save the Mothers is to reflect on what are the next years going to look like. We'd like to see that this program is a program that is a global landmark. And we have what it takes to make it happen. We've got the resources, the ability, and the talent that is there. And finally, as UCU, is to pledge our commitment that we would like to continue to support our strengthening of the Save the Mothers program. We had a decision in our strategic plan for the next 7 years, and we would like to grow our sciences. That's what is stated as a strategic objective, to grow our sciences. And the examples given in growing our sciences is public health, and Save the Mothers is mentioned in there. And so just to comfort that as we move forward is UCU remains committed to work with Save the Mothers. UCU remains committed to host Save the Mothers. UCU remains committed to champion Save the Mothers together with all the stakeholders to see that no mother dies, no child dies, and we can make it. We have got the commitment, we got the resources, we got what it takes. And I pray that we will one day stand here, look at statistics of our journey to making a difference in the lives of very critical people, mothers and children. And so welcome to UCU, welcome to this conference. We hope that you'll enjoy the hospitality here, you enjoy the campus. For those who are coming for the first time, take a tour and enjoy it. And for alumni, thank you for making us proud. Thank you for those initiatives. Thank you for making all the academics that have worked with you very proud. And the founders. Could the founders present stand up? Hallelujah. Thank you, thank you. You don't know the reach that this program reaches. There are lives out there that are touched and they cause a smile. The efforts that you put in, the sacrifices, the hard work in making it start. We may not reward you. We can say thank you, but it's not enough. But our trust is that God Almighty, who knows all that you've gone through, all your dedication and sacrifices, He knows what to do, and we believe that He shall do it. With those remarks, welcome, and may God bless you.
Thank you, Dr. Mugawe. And I think it's very encouraging to know that as we think about the strategic direction of the university, Save the Mothers is in there. There is no better place to be than in a strategy of an organization, of an entity. So a bigger hand clap to UCU. And I know that in our midst is our guest of honor, Dr. Charles Olaro. You're very welcome. And also we have the Minister of Health Local Maternity Network Coordinator in our midst. But before people begin disappearing, we need a group picture, and the photographers can guide us in terms of how we are going through that. And at the next segment, I will be handing over to my colleague, Peter Olet, to guide us and take us through the next panel discussion. So over to the photographers.
Hello, everyone. Some little more energy again. I see that is what I am. A little more energy. You're most welcome again. I am Peter Olet. At least we have been mingling around. We have met in some corners. You have been there to listen to the local initiative at that corridor. And here I'm welcoming you to the yet another very interesting session. Bearing in mind, the theme for the day is to ensure no mother or child may die out of preventable complications during childbirth, and it's a role of multidisciplinary professionals, and these are the professionals here before us. Allow me welcome my colleague Andrew, who is going to take us through the drive to renovate Mirembe Hall. 19 years down the road, we are seeing, yes, okay. Oh, the pictures. Oh, yes. And so we are going to have the pictures of the great team here available. After that, we shall have that drive led by Andrew about renovating Mirembe Hall. Just a quick one. We shall have, we request that the whole team walk forward here, and we have the pictures so that this can remain a remarkable memory in this year's conference. You're welcome again. You can stretch and walk over here and have the pictures. Immediately after that, we shall go to the next level. Just a quick one again. Let me have the team of photographers come over here. Then we are guided. Okay, so yes. Oh, great. So please, let's walk over here and have the pictures. Kindly. Oh, yes, Dr. Jean? All right. Oh. Oh, yes.
Few more up, bring a few more up maybe.
Or again, just to have the documentary quite realistic, we shall have the founding body, the founding members walk over first. Then we shall have the pictures taken. That will be followed by members. Or please, you can see the arrangement here. The founding members of Save the Mothers walk forward, and these pictures will be taken. After this, we shall request the VC to join them. Yes, great. I like the smiles. In music, this would be called a quartet. Yes, thank you. Oh, great. This is a great team that has contributed and is still contributing significantly the well-being of mothers and babies. I like this. Great. Thank you so much. As you sit, you'll be joined by the Vice Chancellor. The Vice Chancellor, kindly join this great team. Immediately, they'll be joined by the ED, Executive Director, Save the Mothers, East Africa. Oh, yes. Okay, that's great. I like this. Oh, yes, great. And following that, they'll be joined by the board members. The board members, Save the Mothers East Africa. Kindly walk forward. This is historic. All the boards, kindly requesting all the boards from Canada, US, East Africa, kindly join us, join this team. Great, you can see this. I like that arrangement. Again. Oh, great. Oh. Okay. Oh, Obed, American board member, kindly join here. Oh, yes, I can see that. You can give a round of applause to this team, great team, having these memorable pictures.
We also request kindly the guest of honor and the MPs to join this team. And eventually the old ED, executive directors, the old ED. Oh, yes. The team is growing gradually, and it's a great team. Yes. Great. Now we invite all, kindly, the family, the entire family of Save the Mothers, kindly walk forward and have your pictures. Everyone here available, our guests, everybody down there, please kindly come forward. Everybody, oh yes, this is our time. Kindly join this great team so that we have the pictures. The entire family here of Save the Mothers. No mother or child should die from any preventable cause or either be harmed. And this is a great multidisciplinary team. We're putting hands together, working differently. Okay. Okay. Those online, kindly turn your video. Those on Zoom, those online, kindly turn your videos, and you will be able to witness this, to see this. Might be late. Yeah. For now, yeah. Okay. Oh, more space coming. Yes. Oh, great. I'm already here. Oh, they can't.
Yes. Can you be shorter?
Yes. Yeah. We're walking down again. Sorry. Yes, yes. Oh, good. Yeah, yeah. Okay. Okay. Yes. Special request to have the children up there to join these the founders of Save the Mothers. Kindly walk forward, the children in the gallery. Kindly walk forward, all of you. We like the zebra color, very humble animal. Kindly walk forward and have the pictures with the founders. As they walk forward, in a very special way, we'd like to recognize the gynecologists in the house. And Professor Justice is here among the team. A hand of applause to this great team. Ladies and gentlemen, thank you. Yes, we are having the pictures by these children. They gave a very powerful message in their song, and this should remain on record for Save the Mothers. Okay. Okay, I like that. So yes, I like the smiles with these goals. Great. You can wave to the audience again, dear children. Oh, great. Thank you. Oh, yes. The photographers are guiding you on the best shots. Okay. Okay, great. I think this is almost done. All right. Okay. Oh, I like this. There's some significant symbols. Thank you so much. Thank you so much. That was great. The founders of Save the Mothers and the children. The pictures remains in the permanent memory. Ladies and gentlemen, going forward, we shall have the drive to Mirembe renovation. And I take this opportunity to invite Andrew forward in 2 minutes. Andrew, kindly walk forward and let us know what is it all about, Mirembe renovation, Remende Hall. Thank you. We also recognize the fact that time is fast spent, and we're aware our guest of honor has some commitments elsewhere, and we shall look into that before we could have everything concluded here. So, Andrew, you're welcome.
Yeah, thank you, Peter. Protocol observed. Andrew Collier is my name. And I'm very grateful for that day. I think today is that day. We've had conferences, but today's conference is more exceptional, that we've had many people from different areas. So I feel a bit happy, and I'll be straightforward to the drive. I will rely much on some books of wisdom. In person, I may not have words. Galatians 3, verses 2 to 3, it says, remember your roots and your future will be secured. If you remember your roots, then your future is secured. Unless your roots are strong and stable, don't expect the fruits in future. I know people are wondering, what am I trying to mean? All of us, we originate from Save the Mothers. That's where we slept. That's where we had lectures from. That's where we had everything good. And we are what we are because of Save the Mothers building. We had a nice structure. We had a nice building. It was a model building to say here at UCU. But if you passed by right now, it's no longer a model building. And yet, most of us were here because that building nurtured us. So that's why Galatians is saying, never forget your roots. So if that building stays the way it are, it would mean in future almost it will be no more. So we must remember it, have it renovated, and have it back to its glory. And then we shall be there. In addition to that, one may wonder, some of you didn't pass there. That's why I'm here, because you must know why I'm here. You cannot know what is happening unless you are told. The same Bible says under Romans 10, how can they hear without someone telling them? How could you have heard this good news about our building, that it needs renovation, unless I was here to tell you? And it is your role as well, because the same Bible says, James 2:17, faith without action is dead. So after listening, you have to remember your roots. You have heard, then what next is action. If you don't act, then your faith is in vain. And there is a word at the end of our flyer here. Every coin counts. That one reminds me the same thing in the Bible. Under Mark 12 verses 42 to 44 of the poor widow. The poor widow did not have a lot, but he said, I will surrender my 2 coins. As we said, faith without action is dead. Behave like a poor widow and surrender your 2 coins towards the renovation of our building. That's why we are saying every coin counts. And I believe everyone is capable of offering at least a coin at the end of the day. It may be in cash, it may be in form of pledge, but we shall have time limit because time matters. But at least everyone has something to offer. No one can say you don't have. As long as you have a breath and God has blessed you, you have something to offer. As I move to the end, in the book of Matthew, our good deeds have an evangelical effect. That whatever we do, the good deeds we do have an evangelical effect. So what effect now are you going to give out? So right now, as we are moving, I call upon everyone. We have the pledge cards. They are with us. I'm sure soon Topi will be producing them, and they will be given out in teams. As an individual, please be like a widow woman. Offer something. Offer that coin. We shall have them in teams. Team Canada, we shall give you yours individually and a pack of 20 cards, so that when you go back, you get to know that we are here in need and we want to revive our roots so that we don't perish. It's not about all the building, even in our program, MPHL. Wherever we are as an alumni team, let's mobilize so that our program is not absorbed by the School of Public Health. Otherwise, it will be absorbed, and at the end of the day, we shall be no more. And then they will ask you, which program did you offer? MPHL. Where is it? It was absorbed by Public Health School. Please, let our program absorb the other program, but not ours to be absorbed by the other program. It is the role of everyone wherever we are. We should reign, and we should be heads and not tail, like Deuteronomy says. So let us lead as we are leading. Thank you very much. Pledge cards will reach you. They will be in envelopes. They will be an individual. Take one for yourself. Take 2 or 3 for other alumni. I wish you well as you are going back home. Thank you. Koliandu is my name. Principal Town Clerk, working with Kagadi District Local Government, and Country Manager working with Maternity Worldwide, UK. I'm inviting you on 14th May as I celebrate with the team the Midwives Day in Kagadi District. It has always been marvelous. Thank you. All the best.
Thank you so much. Thank you so much, Andrew. And we heard this morning local problems, local solutions. But this time we might grow bigger and calling for international solutions to local problems. I thank you again. As we invite the panelists, we'll be walking forward here. Let's have the pupils, the students come forward for the presentation that you have. Yes.
Sorry, there's something I forgot. I was supposed to say that please, whoever is here, whatever you have, you are free to offer. Carol Namono is ready to receive it. I, as a person, am ready to offer 500,000 as Korea Andrew towards the drive. Thank you.
I like that. You know, it's good to open the gate. And if you'd like to pronounce that, take your time, and I will allow you 2 seconds to walk forward and pronounce your contributions. Let's have the kids walk forward. The panelists that we shall have, yes. Oh, yes. Let's give a hand of applause to this great individual who has walked forward to pronounce his contributions.
Yes, praise the Lord.
Amen.
Yeah, I think we'll do it just in the quickest time. People come and pronounce. This is the first time we are meeting. I've been seeing it running on the platform, but I think now we can just come pronounce, they write, and then they follow us up. For People's Life Care Foundation, Mbare, 1 million shillings.
Very well, thank you very much. That was a few seconds pronouncements, and you could take this opportunity as well to walk forward and pronounce your contributions as we get ready for this presentation. Yes.
Good afternoon, everyone.
You can.
Good afternoon, everyone. Good afternoon, everyone. Yes, I'm Virginia. I can't allow my children to present when I've not made any contribution. Okay, so I'm going to make sure Triple P School contributes 500,000.
Yeah, Madam Carol, people are wondering who is Carol. Carol is an STM accountant. Please, do you mind if you are on? Come forth and be first for the interest of time. So as people are pronouncing, please note and then follow them up. The contacts of Carol are displayed on the screen. You can always reach her as they are there. She's here and she's the accountant. Though we have the committee members, can you stand up for recognition of this drive? So whoever is standing, we have Rebecca, Dr. Obedi, Gladness from Tanzania. Yeah, Dr. Obed nowadays they say is a member from US. Congratulations for that double citizenship. Yeah, my sister, pardon? Harriet, yeah, Harriet. So come and you declare your contributions if you are ready. No worries. The microphone, I think we can have it move around, Peter, very fast. Allow us 2 more minutes to do this.
I like that. I think we have recognized that some people would like to pronounce their contribution at comfort. You could simply raise your hands.
Just put your hand up.
And yes. Can I see some hands up there?
Praise the Lord.
Amen.
My wife and I had already made a contribution of 250,000, but we will top it up to make up to $200. So that comes to about 700,000 shillings.
Thank you so much.
Yeah, thank you, Dr.
That's a great one. I can see another hand up there.
Good morning, everybody.
Good morning.
I'm placing a pledge of $200, which I'll contribute as individual. And I will see how I can collect from my colleagues who have not been here from
Great.
South Sudan.
Thank you so much.
That's Rauben
Like-
from Sudan. Thank you.
That's great. And
Any other hand?
right, in a few more moments, you can think
Yeah.
about it, and
Yeah, there is another
you'll be
hand
able
there.
to declare.
Good morning, everyone. I'm Helen Grace Anyoda. I'm a class 2017. I work with Uganda Blood Transfusion Service. I'm the in charge of Lira Blood Bank. I'm pledging 500,000.
Great, thank you.
It is because from Save Motherhood, I've seen a lot. I've learned a lot. Much as I was already with the blood bank, I wasn't seeing why I was really collecting blood. But it's from the class that I was in that I learned that actually it's very important. And I greet all of you. I should say Save Motherhood is something that we should really go for.
Thank
Without
you.
it, we can't do much.
Thank you. Thank you so much. This is a great
Thanks for
testimony.
not forgetting your roots.
We love
Another hand
that.
is here.
Yes.
Good morning.
Good afternoon.
Good afternoon.
Yes.
You know, the weather, it's tricky.
Yeah, the weather can be a morning hour.
Yeah. My name is Juliet Ruth Bokelo, class of 2015. I learned a lot from Save the Mother. I love mothers and children because I'm a mother.
And that's why you're pronouncing your contribution.
Yeah, I'm a mother of a set of twins, a set of triplets, and a single.
Wow. So if you want to talk about
I-
fertility rates, you
Yeah.
can consult her.
So I am special in a way. So me and my set of children, I am giving a contribution of 1 million.
Rich. Triplets.
Wow.
You can
Praise
see
the
that.
Lord. Praise the Lord. Choya Gara.
More ideas on fertility.
Yeah,
consult her.
here
She's
is
a
another,
consultant.
here is another contribution, Peter.
Oh, yes.
From Choya Gara Penina.
Yes, Penina.
1 million contribution.
Thank you so much,
you.
Penina.
Is she around?
There's a hand. There's a hand.
Yeah, our doctor.
Great.
Not a medical doctor, but a PhD doctor.
Great.
Thierry, my classmate.
Yeah,
Thank you.
very much. First of all, I would like to thank Save the Mother's family, particularly Dr. Jean, who came a long way from here, Mukono to Kigali, to see me. And then she told me what Save the Mothers is all about, particularly this master's degree.
Oh, yes.
Then at the end of the day, I joined.
And so you can pronounce yourself.
Yes, and I completed the program. Right away after completing the program, I joined the PhD.
Yes.
In the UK. Now I hold a PhD in integrated nursing and midwifery as a result of being part of Save the Mothers.
Yes.
So as a result, I pledged to give 500,000 Ugandan shillings, but the moment I have 50,000 Rwandan francs.
Oh,
so
yes.
I don't know how much it will be in Ugandan shillings.
Oh,
but
yes.
The balance will come.
Oh, great. Thank you. Thank you. That's a great pronouncement.
Yeah. Carol Namono.
I'm not sure I've seen a hand
as well.
behind.
Come closer to me. There is some cash.
Let's
There's a hand.
quickly a hand
Yeah,
near
please
you.
Never forget your roots. That's what Galatians says.
Oh, yes.
Thank you. Good afternoon, everyone.
Hello, yes.
Habari.
Nzuri.
The team of from Tanzania. And also we thank you, everyone. We thank you, UCU, STM, Dr. Jean, Dr. Eve, Dr. Olive, Dr. Paya, Professor Pius, Professor Mirembe, all of them. We thank you very much. I'm the pioneer of international class from Tanzania. And I recruited some students from Tanzania, and the product is here.
Oh, yes.
Yes.
Amazing.
Yeah. We thank God.
A great team from
We are
Tanzania.
proud of UCU and STM.
Oh, yes.
Always. Yeah. So we decided, you said that 3 of us, we will send, we are pledging 500,000, is it 500,000?
Oh, yes.
Ugandan
Tanzania,
shillings.
Ugandan shillings. Oh,
Uganda
yes.
shillings, and we will send to Carol
Oh, yes.
Namono.
Great,
Thank you
thank
so
you.
much.
Contributions from the
Regarding
team.
that, we have something to Dr. Jean,
Oh.
as we are going also to sing that song as we are going to Dr. Jean. Yeah, thank you.
Okay.
Thank you.
A
A
special
gift to Dr. Jean. This is a special gift.
Kusema asante, asante, asante.
They're saying thank you so much to Dr. Jean.
Kusema asante.
Special recognition and special gift.
Asante.
Oh, yes.
Tumekuja kusema asante.
Thank you so much, Dr. Jean, for coming to our rescue and being the founding body for Save the Mothers East Africa, Save the Mothers internationally. Thank you so much. This is great. No more cold. Thank you.
That is Gladness
oh, yes.
and team. 500,000 has been offered. I saw another.
Oh, yes,
hand.
Andrew.
There
Andrew,
is-
kindly, there's a hand here. Oh, yes, quickly. Then you come over here.
The hands are men. Please keep putting up your hands. That's so great.
Oh, yes.
Be like a widow. Give what you have. Every coin counts. Thank you.
Thank you so much. My name is Emily Mtuhaire, class representative for the class of 2022.
Yes.
Some of my classmates are here.
Great. You're most welcome.
Yeah, and
2022 class.
we are so glad to be here and passionate about Save the Mothers as a class, a small class. We would love to give in a pledge of 600. And if more comes, we'll bring
Thank you so much. 600,000 Uganda shillings.
600,000?
From the trio, from
Wow.
the 3 alumni. Thank
Yeah,
you.
I've
Save
seen-
the Mothers, Florence alumni is here. Kindly,
and team, thank you.
kindly reach out. I like the energy.
Another microphone, please.
I like the vibe.
I need some backup. Now I'm getting. Yeah, thank you. Here is my best friend, Diane. Finally, we've met after a long period of online chats. Thanks be to God.
We've been LinkedIn friends and we finally got to meet today.
Oh, yes.
And to celebrate that, and because I'm shillings challenged, 500 Canadian.
Yeah.
Thank you so
500
much.
Canadian dollars, I think. Those
500
are dollars.
Canadian dollars.
500
Thank you.
Canadian dollars. Thanks, Diane.
Thank you.
Jones. Yes.
Florence. Oh,
Good
yes.
afternoon. I'm Tessa Sharon.
Sharon.
And I am a child to Diane Reader Jeans. She has been my mom and a sponsor from my childhood. I've graduated in medicine. I'm a medical doctor, and he encouraged me through my mentor, Jean. I've just finished my master's degrees in obstetrics and gynecology. I'm so grateful. And I have a contribution of 200,000 Ugandan shillings.
Thank you so much for your
Diane's
contribution.
daughter has made it. Yes.
Yes.
Another person.
Over there.
Yes, and thank you so much, everybody. Our table is representing
Which table is that?
this very table where we're
I like the
standing.
table.
Headed by
It's
the name.
representing a class of 2012.
Yes.
And we want to say thank you to UCU. Thank you to Professor Kong, Pius, Jean, Dr. Jean, Dr. Florence, Dr. Olive, Dr. Edward Mukoza, and everybody here. We are representing a class of 2012, and if you are there in any table, we can see you by show of hand. Class
Oh,
of
yes,
2012, you
2012.
are there?
National class.
Yes.
Yeah.
If you're not there in our class, we are giving our contribution of 2 million.
Thank you so much.
Allow
2
me-
million Uganda shillings.
Can we have the focal person?
Oh, yes.
The name of the
Yes.
focal person?
My name is Florence Ariemo. I work
Florence.
with USAID, Uganda Health Activity, based in Lira.
A great
Allow my
partner
friends
in Northern Uganda.
just give and greet you, tell you their names.
Thank you. I can allow you 1 minute because of the good pronouncement.
Wow.
Yes, thank you.
Good afternoon, everyone.
Yes, afternoon.
Me standing, I'm called Mrs. Comfort Oguti, class of 2012. We are grateful, and as a team, we are excited to give back to UCU,
Thank
Save
you.
Mothers.
Thank you.
It did a lot in our lives.
Yes, you have not forgotten your
so
roots.
much.
Thank you.
Never get tired of doing good. That's great.
Oh, yes.
And I'm Paul Gabula. I was the class president for 2012.
I always
Yes, my
do your
colleague
next
president.
slide. Thank you.
It's a blessing, not just a good thing, but it's a blessing to have been part of this program. And we are excited that we are giving back to the mothers that shaped our future. Many of us are in these positions not because of what we are, but because of the touch of that program. I work with the Dutch Ministry of Foreign Affairs with a program called Right to Grow, based in the Netherlands, but my offices are in South Africa. Thank you.
Thank you. You're most welcome. Regards to our colleagues in South Africa.
Everyone, I realize that our 1 minute is long gone. My name is Restituta Kaguma Nabwire.
My boss.
Oh, yes, great.
I work with the Alliance of Mayors on Health in Africa, and I'm very grateful that we have this opportunity to give back. What I can pledge is that the class of 2012, we have a WhatsApp group, and we are going to continue the mobilization.
So it may be more than
Thank
2.
you.
That's so great.
The resource mobilization will continue.
Nabwire takes mayors and town clerks. Somewhere town clerk, I fall under her activities.
Great.
Proud to have you here.
Thank you.
Here is another pledge from Biamugisha Obed, class 2018 pledge, 500,000.
Thank you. One more person from that table. Sorry.
Let him stand up.
Sorry, Andrew.
Yes.
Let's wind up with this table. One person.
Oh, sorry.
Yes.
I'm called Jeremiah Mbulamani, and most famous in Save the Mothers.
Thank you.
I work with Mothers Heart Uganda, and I'm the founder.
Oh, great.
Amazing. Here is
Thank
another
you.
hand.
Thank you so much. God bless you. We
Amen.
love safe motherhood, and personally, I'm an advocate of safe motherhood. I have a passion to ensure that infection prevention and control is actually the baseline and the key to save and reduce maternal mortality and neonatal death among mothers. God bless you.
Thank you.
Thank you. Here is there another pledge.
Good afternoon, everybody.
Afternoon.
I'm Oriema CB Jimmy. I'm a senior clinical officer. I work in Pakwach District local government. Pakwach District is as soon as you pass Pakwach Bridge, you enter the district. I made an effort to ensure that 2 students who joined here also graduated in the names of Dr. Pacho Robert and Sister Mono.
Both in my class.
Yes,
of
I am
2018.
the one who ensured that they followed me.
Thank you.
So, as I heard about Busoga Forum, I want to guarantee that we are also going to have the Greater Navy Forum.
Oh, West Nile.
Constituting the 3 of us.
Thank you.
I'm a son of a midwife, a senior midwife, retired. So I joined the medical profession not by accident. That could be inheritance. But allow me also to appreciate Dr. Jean and Dr. Eva, who really encouraged me. Dr. Eva was my supervisor. And finally, I graduated. So as a senior clinical officer, at the end of the month, I'm giving back to STM 150,000. Thank you.
You so much. And Andrew, kindly look up here. We shall allow more contributions without pronouncement now but immediately you collect all that, kindly send forward, and we shall announce all the contributions. Thank you so much. When you raise your hands,
Yes.
Andrew will reach you and the team. You make pronouncements in writings, then we shall be able to get back to you and announce to the team. Thank you so much.
Thank
Is
you.
that the last one for now?
Good afternoon.
Good afternoon, sister.
Amodo. I'm the MCH focal person of Yam District. We work together with
Hira,
Peter.
she's my senior and supervises our sub-county.
So I'm saying, since I know a lot about mothers. I'm a senior midwife who has done the work for more than 20 years, coordinating emergencies. In Oyam, I'm the one who coordinates the ambulance movement for picking the mothers, and I'm sure we are really saving life there. Therefore, I added a much knowledge in STM 2018 group. I'm pledging 500,000. I'll be sending.
Yeah, 500.
Thank you so much.
I have a request. People
Yes.
are giving
long stories,
but they would have loved to say it. I beg for 3 minutes that people just mention a name and
Kindly, with authority granted to me, I advise that we move forward. Kindly put down your pledge, pronounce it in writing. There's small seats there. We shall actually announce it here and clap for you many times. Yes, thank you so much. Kindly walk slowly without a microphone to every individual's pledging. I invite these students to present as we prepare to welcome the panelists. Here, the seats are available. Forward here, we shall have Moses, Martha, and Dr. Jean and Professor Justice coming forward as we have this presentation. Thank you.
We can't sleep when mothers are dying. We thank you all for inviting us today. It is a special
Thank you so much. Let's clap for these girls again. And we welcome the panelists coming forward. Please take your seats. I have already invited the 5 joining us here. Kindly note that this team will take strictly 6 minutes to unveil the package they have for us in today's very important conference with a very special theme. And here they look energized and ready to unveil what they have for us. Kindly, following this order. As you check from the order in our schedule, we shall have the first in the panelists. First of all, they will all introduce themselves. Immediately after that, you will be able to listen to their brief deliberations towards this very important occasion that will remain in history. Immediately after that, we shall expect you to note any question for them, at least 1 minute each again, to respond to any questions or concern that you'd be having there. So here we have Moses, who will open the floor. Right.
Thank you so much. My name is Moses Changwa. I'm the Chief Executive Officer, Busoga Health Forum. STM, I was in year 2013. Thank you so much.
Thank you. Again, introduce. Let's have the whole team introduce themselves.
All protocol observed. My name is Martha Agilo. I work with Uganda Blood Transfusion Services. I'm a senior blood recruiter. I'm based in Soroti. I'm cohort 2010.
Thank you.
Professor Justus Baragaine Kafunjo is my name. I am a gynecologist, obstetrician, fistula surgeon, teacher, researcher, and I work at Makerere University, Kampala International University, East, Central, and Southern Africa College of Obstetricians and Gynecologists. And generally, globally, I taught treating women who are disadvantaged with birth injuries. I previously was a coordinator for MPHL program, but when COVID came, I lost the contract. I'm still waiting.
Yes, I like that.
But I am proud to have supervised a good number of students here, over 40 completion. And since I've not reached time to say what, thank you, Jean.
Thank you.
Who recognized me when I had just finished my PhD. I think I'm a better person because of the experience you gave me. I thank you.
Thank you. The longest CV so far. Let's listen to the next.
My name is Dr. Jean Chamberlain Froese, and I'm an obstetrician gynecologist. I'm a professor at McMaster University, but my greatest joy has been to live here at Uganda Christian University for 12 years. And wow, to see all of you today.
Thank you. Thank you so much. Now, Moses, given this great day that will remain in history, what do you have to unpack to the audience? We have the viewers over there, and they're interested to know via the theme, which is very clear, and it's about preventing death to mothers and children. What do you have to say?
Thank you so much. About the theme, preventing mothers from dying, and coming from Busoga Health Forum, and with the knowledge I acquired from Save the Mothers, I look at this as a responsibility of everyone and a role of everyone to play. And so if everyone played their role as healthcare providers, we can prevent mothers from dying. Thank you so much.
Thank you. Once again, I think you are very much ready and prepared to have this audience get special message that you would give them in this very special day. What is that exactly?
Thank you so much. The special message I want to give today as we celebrate 19 years of Save the Mothers is that ever since we got into the business of Save the Mothers, issues of safe motherhood have improved in Uganda. And in Busoga, where I come from, Busoga is 12% of the Ugandan population. And so our indicators in Busoga mean a lot to the Ugandan indicators. So the Save the Mothers program has equipped many of us from the region, and we got challenged, especially during the time of COVID, when everything was cut off. And for us in Busoga, we live in an island. Busoga is an island surrounded by waters. So we said we cannot just sit down with this knowledge we have from Save the Mothers. We decided to go digital because they had stopped everyone from traveling and what. So we mobilized all the professionals in Busoga, and we registered all the professionals, regardless of the courses they did. We said everyone is a healthcare provider. Everyone can provide something. So we mobilized 6,000 professionals, not medical professionals, but professionals in general in the Busoga region. And we put them in different WhatsApp groups, and we started discussing. Mothers were dying, mothers were not accessing care. And with us, Busoga, if you want to know how we behave, touch the mother, touch my wife, then I will show you who my true colors are. So when we saw this happening, we mobilized health workers, we mobilized everyone. We came into groups and we started discussing, then ideas came. So using our leadership skills here, we put different people in groups, advocates for safe motherhood, advocates for training health workers, advocates for this, and brought the business community. Can we provide services to our people? So we started mobilizing, we formed the leadership, and within 1 year, we mobilized 200 million shillings from local individuals. So we therefore funded ourselves and we became an organization. In the second year, we mobilized 600 million from people, not donors giving us money, but whoever became a member was contributing 100,000, 1 million, 5 million. We put an organization, we put a board, we put a secretariat. We started funding from within. And I tell you, from that, the network courses we got here in safe motherhood, communication and collaboration, community engagements, we started partnering with local village groups, partnering with business partners, and then people started sponsoring different groups. We put up pro bono programs and say, we want to screen mothers for diabetes, mothers for hypertension, and people started contributing. As I talk now, we run an organization that has a budget of 2 billion every year. And most of this money is coming from the local professionals in Busoga. And the power of this is the power of partnership, the power of collaboration, the power of community engagement. Some of these are the skills we got from Save the Mothers.
I like this. Yes, thank you. Thank you so much. You know, it is starting from within out. That's a key message for me. What would you like to say as the take-home message for this audience? Given all that background and the struggle, and you are seeing things coming out for the success and saving more mothers and baby.
I would say start from what Rogers said. You know, I work with Rogers. Local problems
local solutions.
And then we have all the resources we need for the problems we have. We only need good leadership. We only need collaborating with the communities, and these communities have the answers. For us, everyone who joins us must join with value. You don't just join us when you don't have value that you bring. So whoever we put in a leadership position, we start with them. You, the board chair, what is your contribution? You, the LOC5, what is your contribution? So we have all the resources we need, but we only need good leadership. I tell you.
Good leadership.
Yeah.
Thank you so much. Let's give a hand of applause to the great man of God, and let's welcome Martha. Martha, now, quite a great deal. We are seeing things work out from within out, and lessons are being learned. Picking from the theme of today, what special package would you want this audience to pick from your experience of working in this local context?
Thank you very much. Before I enrolled for STM, I was doing my routine work, community mobilization for blood donation. And our work was basically to mobilize communities. So I didn't have anything to do with the facilities because I stopped at mobilization. A team goes collect blood, and it's another team, the lab, that deals with the facilities. After this program, I realized that I have the power in me to change the narrative. So I'm based in Soroti General Referral Hospital, but I work, my catchment area is Teso sub-region. So within the regional referral hospital, there was always a challenge of the obs-gyn team and pediatricians accessing the blood. Blood could be there, but there was always, I think they needed a connection, someone they could always rely on to have it in the event that maybe it's not there. So when I thought I have the power, I come from the journalist background, from mass communications. So I started to use the power of communication. So every intervention I've done, basically it's on, I ride on the communication strength that I have. While at my space, we also realized that there was always this blame game between the facilities and blood bank. Every maternal death, a facility will say there was lack of blood. For us, we know we have blood, and said there has to be something to be done around here. Then you'll find that facility A has blood, facility B does not have blood, and facility B has, a patient has died in facility B because there's no blood, which facility A has, and they have not used it. So I came up with the local interventions to address these issues. One, I came up to the gyn team and the pediatricians, and I became the liaison person. So anything about blood when it's not there and they need it, they will call me directly. Especially when you come to these resource negative units, come to the blood products, platelets, and maybe FFPs that we don't. At the moment, all our processing is done in Mbale. So I became that liaison person. So it became easier for them to do their work because now there's somebody to be in touch with them. Secondly, we also found that in maternity, there is a way these emergencies come in odd hours. They love nighttime, odd hours. So we said, what can we do about this? Around January, we lost a mother, and just when blood had gotten done, so I met with the maternity team in the morning, and I told them, I asked them, what can we do? We have a fridge. I called the lab person. I'm not a scientist. I called the lab person, come and assess the fridge. I said, now we are going to keep the blood for maternity, for gyn ward in this fridge. Just a few, maybe 3 or 4, to cater for these odd hours of the night. During the day, we can get the blood, but for the night, let this blood be there. So that you can just pick your unit, go to the blood bank, hospital blood bank, do the blood grouping and the rest, and come back and, transfuse. So from that time, that has been sorted. When the fridge broke down in last month, we withdrew the blood because now the fridge had broken down. Within 3 hours, the nurses, the midwives had gone to the store and said, we want a fridge from the store. And they came back and said, the fridge is there, bring back the blood. So now that I appreciated that intervention, and it works very well for us right now. The other local intervention that I did was it sort out the blame game, and blood is here, it's not there. I came up, I met with my team at the lab. I told them I have an idea. I want to open up a WhatsApp platform where I'm going to add all the lab staff of all the transfusion units, all the in charges of these transfusion units, and then the DHOs. Now, these people are going to place their orders in the platform, and then we are going to respond. And then we're also going to encourage facility coordination. If I need blood group O and it's not there, and my brother has it, it's going to put the facility that I have it, then shall coordinate and say how this blood is going to move from his facility to my facility. And if his facility is not picking blood, if they're not putting a platform, then I'm going to reach out to the DHO and the in charge and find out why aren't you picking blood? And yet you know you have facilities in your district. So I find that everyone gets accountable to ensure that the blood is there in their facilities. So that has also sorted out the issue. Also the waiting time for these lab people. Initially they would come and they're not sure if they're going to be served on that day.
Yes.
Or we have received the results, or we're going to say wait for the whole day. Some of them got laid back in coming for blood. But now you're going to put your order there, and we're going to tell you, please come for your blood, either tomorrow at this time or today at this time. But for emergencies, don't hesitate to call at any time, and you're sorted out. So all that has sorted us in the region and has come out. And because of those local interventions, I was also recognized last year for that, for the Safe Motherhood Award.
Great. Hand of applause to Martha.
So local solutions.
Local solutions.
For local problems.
For local problems. And there's power in communication and leadership. I think it has been wise to think about leadership component in Save the Mothers program. Let's clap our hands again in appreciation for this. But before we move out from you, Martha, it seems you have made a great change and you're a change agent. What special key message would you leave with the audience?
To the audience, I think as multidisciplinary actors, we are placed in unique positions to change the narrative. Wherever we are, we can do something. We don't have to have a bigger position for us to change the narrative. You can start from where you are, from small thing. I know each one of us can identify where there's a gap at our places of work, in our communities. Let's start from there. For example, you can say, I don't like how this is done. What can I do about it? It may not be you alone, but you can approach 1, 2, 3 and say, we can do it as a team. But we are all positioned uniquely to make a contribution to better the outcomes of mothers and children.
Thank you so much. Once again, a round of applause. And moving forward. Thank you. Well introduced, Professor Dr. Justus Baragaine, with that wide range of experience, being a lecturer in the department and coordinated the program for quite some times. Save the Mothers is being seen as a very special program and well recognized by UCU. And now here you are once again. What special attributes do you see to Save the Mothers in working with the multidisciplinary professionals? Has it been an easy thing? How do you see it?
Thank you very much, moderator, for that nice question. First of all, I want to congratulate Save the Mothers, the far it has gone. But also, I want the gynecologists who are in the house put up their hands.
Oh, great. Gynecologists, hands up. Great.
And you clap for them.
Oh, yes, again.
Why am I saying this? If you remembered the constant figure in the pictures that were here, they were the founders, and all of them were gynecologists. But you never talked about Association of Obstetricians and Gynecologists of Uganda. Now, Association of Obstetricians and Gynecologists of Uganda is very happy to see programs like Save the Mothers. Because how did it start? It was a group of obstetricians through collaboration, Association of Gynecologists of Uganda and SOGC, that's the Society of Obstetricians and Gynecologists of Canada, that came together and they thought, after analyzing all the factors that was contributing to maternal and newborn death, that we needed to look at a multidisciplinary approach. And that's how we come in with the Professor Mirembe, Professor Pius, Dr. Oliver Centumwe, and the rest forming this program. And they looked for where to house it. When they looked for where to house it, they found UCU as a home. Thank you once again. When you reached, you never visited only, you decided to establish yourself. No wonder we have Mirembe Hall and STM House. Clap for them once again. And because of that, we have this great community of alumni of Save the Mothers. And I know Save the Mothers has passed through a lot of time. 19 years is not small. At one time it is high, at another time it's low. But I think where it is now, I can always say, let's keep high. Now, I was requested to briefly talk about research. Now, all the alumni who passed through the program, if you ask them what challenged them, it was not the safe motherhood movement, the whatever. When they finally were told, write a research or a dissertation, it became a problem. And I want to thank one person, Professor Pius. Those of us who have been to school from this side of the world would start from soil, writing, learning how to write. And I think when it comes to research in Save the Mothers, there are people who have been teachers of this great society of STM alumni, trying to help them first write in soil, then on a board, then finally on some piece of paper, and finally they start writing projects. And who are those? Pius, Dr. Mukosa, Eve, Jean, but I wouldn't forget myself. Yes. One thing that I saw when I came in, I found somebody had started the program and had not finished. And remember, it started in 2005, and I came in 2015, and somebody still in the program said, this must be Stony Heart. But to my surprise, it was a research. Now, research is simply means doing something systematic. You observe something, follow it. Now, we cannot stop maternal perinatal death without systematically following it. And how do we do that? That's when I come to thank the Ministry of Health. We have a local maternity network. I think Dr. Oraro, you must be proud. When you tell these people that we are doing this, talk about what you've done. Each one will talk about a great thing, but tell them, show the numbers. That's where the dwarf are separated from the giants. Now, the local maternity network is actually showing us that, and it is some form of research. where you are in your community, a woman dies, you look at this woman, you analyze what could be the cause, follow it up, you present it to the whole country. No wonder we are saying our maternal mortality ratios have gone down. Actually, the one of Kenya has gone up. So in the region, our MMR is the best now. But still, we are losing around 300. But how can you make people learn that actually these numbers are there? A woman will die, everybody will go and bury, they'll forget. Until when you write something and another one writes something and you come together. So what do I want STM to do? First of all, once you come, you know you are going to do research. Number two, you cannot do research. Research should not be, you don't do it de novo. There must be something where you are building from. So you have these gynecologists who are old in the program, but also have new ones like Dr. Suga, who is my student. They must come in and actually guide you. Number two, as it was the issue of writing. You know, they say if you want to write something from Africans, you put it on paper. I'm telling you, when you can pass through STM, they no longer hide things in writing. But the most important thing that I would want STM to do, we have said we have 500 products from the program. If these produced one paper, one written paper, and we published it, I'm telling you, UCU would be number 2, Makerere University in terms of ranking.
Thank you.
And finally,
yes,
as the president of gynecologists of Uganda, I want to say,
kind of listen to the president.
Yes, the only president in the house.
Yes.
And I want to commit before my predecessors, Dr. Pius and Professor Mirembe were presidents of this association. We are ready to support you. Don't lose this program, public health, because public health is looking at all those things. I've had a chance to do public health. MPHL is very unique, and the research component we commit will keep on coming to assist. Bias will keep on coming to assist, not throw him away. They say the new broom cleans better, but another one knows all the corners. With those few words,
thank you, Professor.
Keep the banner, but also the last comment I wanted to make.
Yes.
Of local solutions, local problems,
local solutions.
That's what you said when you want to remain behind others. In our culture, they say, if you don't move out, you think your mother cooks well.
You'll not realize.
You need to have all these solutions have universal, problems have universal solutions. And the only way you can do that is to make sure that your research, the numbers are brought here when you are in Nkoyoyo preaching, bring numbers so that things are seen the same way. I don't want Canadians to do things their own way. That's why we have FIGO, why we have AOGU, why we have EXACOG, why we have WHO. Things must be done with global solutions.
Thank you so much, Professor. Very special message from Professor Justus is that local problems also needs. Are you sure? Are you sure? It's a different assertions. Local problems requires universal solutions. Oh, yes.
They do. Some need local solutions.
Oh, yes.
But those local solutions must be universally accepted.
must be universally acceptable. Thank you so much. This is from the background of research, and it's so skeptical to think that whatever solution you're able to generate must be internationally accepted. And I think this is a wise comment. Thank you so much. A round of applause again to Professor. Once again, we have the next panelist. Please prepare for a question, at least for each panelist here. Dr. Jean. Now I can see the beam in the face, and everyone is eager to hear from you, being one of the founding member and keenly following the steps of Save the Mothers. And here you are with a great team from Canada, from US. Above all, the numbers grown bigger. What do you see Save the Mothers now, and how would you want to see Save the Mother in future?
Great. Well, thank you very much. It's wonderful to be here and to share with each one of you. You know, just as I reflect on Save the Mothers, one thing that really stands out to me is working together with other people. And I love sitting beside Dr. Justice. I realize how smart he is and all the research that he knows. I'm not so familiar with all the things that he knows, but I have a certain skill set. He has a certain skill set. And as we work together, that's really what gives the power of this program. And when I think about the early days, Dr. Pius, Dr. Florence, Dr. Olive, it was really a group of us just coming together. Simple people. You might look at me and say, who's that woman? Well, my colleagues will tell you I'm some small little person in Canada, but by God's grace, a group of us came together, worked together, saw the need, and really that's what has brought us where we are today, is coming together and working together, and also having hope and faith. And as Christians, having hope that God would help us, and here we are 19 years later, almost into 20 years, seeing what God has done. So that's where we've come from, working together, and we still do that even today, working here with the university, we've already heard. And as we look to the future, I see the same. I see us working together, working with the various skills that many of you have. Many of you are in places that lots of us will never be able to go. We hear your geography, we hear where you're working. So working together and then working by faith, that hope that God's going to help us to do things even more than we could have ever imagined. So I just want to encourage you. In fact, can I ask everybody just to look at your hands right now? Just take a minute, just look in your hands and say, what is in my hands? What are the skills? What are the gifts that I have? And what can I do for Save the Mothers, and more importantly, for safe motherhood and for the children here in East Africa and beyond? And in fact, as we look towards the future, Peter, we don't want it just to be in East Africa. We need it in West Africa. I was just recently in Nigeria. Again, same issues. And the same solution is needed. People working together with different skills, different abilities. And we just look forward to an expansion of Save the Mothers to other parts of Africa and even beyond. And of course, our Mother Baby Friendly Hospital with the local health, maternal health network, again, just spreading that all across East Africa. So every woman has a safe and a dignified delivery. You know, very recently in Canada, there has been a huge crisis for housing. Now, if you can imagine my city, do you know what is in front of my city hall? There are about 20 tents. They are literally small tents. Now, you can imagine living in Canada and living in a tent in the wintertime. These people are without houses. And it is a big, big crisis in Canada right now. And it is affecting so many women, pregnant women. We have women coming in with no prenatal care. Can you imagine a woman coming in with no prenatal care in Canada? And she comes in with a major complication. But you know what? When she comes in, by God's grace, we're able to save that woman. Several women have come in and have almost died. They've been in the intensive care unit and almost died. The solutions to those issues are very, very complicated in Canada as well. And I'm not pretending that I know them. But my encouragement to all of us, wherever we are, is to look at the situation that is around us. Let us work together. Let's not have the tents out front of City Hall. Let us not have people who are excluded and who aren't able to access the care that they need and the housing. And here in East Africa, that women get the care that they need and their children. How do we do that? We work together. We work by faith. And I just look forward to all the good things God is going to do through all of you. I am so excited. My friends here from North America, we've just been wowed this week to see all of you. So thank you for coming, and look forward to the future for Save the Mothers. Thank you. I cut it off. Our MC will continue.
Oh, thanks. A round of applause again to Dr. Jean. Quite interesting, and we have the hope for a better future. Yes, thanks again. You will have an opportunity to ask a question, at least for each of them. We shall take in one question for each panelist to save time. And I would like to ask colleagues down there. Yes, Andrew, you can pass mic to the audience so that we can have some questions. You could be having a question, and as we wait for that, there's been looming concern from alumni about PhD program, MPHL PhD program. Dr. Justice, I have seen you respond to some of these concerns. Have you remembered to talk about it? Is there any hope that these 500 team members could have a start?
Thank you very much once again. Is there hope to do a PhD? First of all, as an individual, you have already seen Dr. Kawanda and others have already, my friend from Rwanda, they have already had PhDs from recognized powerful universities in the north, one in the US and one in the UK. And what does that mean? That the program we are doing is fully recognized internationally.
Yeah.
So as an alumni, you can only blame yourself if you don't proceed to do a PhD. It's not the program that will limit you. Once you have the certificate from UCU, confirming that you qualified with MPHL, then you are fit to go anywhere in the world and pursue your career. And I think you've seen from so many people have talked. Now, as for the PhD, some alumni were asking, can Save the Mothers start a PhD? Probably yes, probably no. First of all, if you look behind and you look at the gynecologists, knowing that Save the Mothers program was originally from FIGO project and SOGC and OA Association of Gynecologists, we can use that opportunity knowing that gynecologists are well studied. I'm telling you, one of the professionals in Uganda with PhD supervisors who are supposed to be having PhDs actually, because you cannot supervise a PhD without a PhD, is obstetrics and gynecology. Professor Mirembe is there, Pierre Pius, myself. There are so many. We have up to about 30 PhDs in the association.
Great.
As for UCU, you know, to start a PhD, you need accreditation by National Council of Higher Education. And one of the things they look at is what do you have on the ground. They look at when you have shown them the buildings, your capacity to host everything, they look at teachers. So the only solution is that you cannot be an island independent of other men. If you give an example of Makerere University, it is not to have the personnel, but collaboration. If you collaborate locally with the local universities and internationally, I think you can start a PhD program. All that is important is be focused, and you know, this is what I have, what I don't have, it is available in the world. And with academics, we always share. Thank you.
Thank you so much, Professor. And thank you. And with that, we come to the end of this presentation. We realize we are slightly behind schedule.
Somebody had something burning under there with the mic. Use
Burning?
just 30 seconds.
Is that an emergency? Martha is here.
Well, it wasn't an emergency, but it's something that we need to reflect upon.
Yes.
Given the concern Professor has raised regarding the publication output from the research project that are conducted by the student of the MPHL. So I just wanted to hear from the panel what should be the strategies that we can adopt such that what we do would not end up remaining in the office of the postgraduate office, given that they can raise the international ranking of the UCU, not only UCU, but also Save the Mothers.
Thank you. And it's the last one. We are sorry. The program is likely to adjust because some people have got some other issues to attend to, and we don't want them to leave.
Very well, thank you.
We shall return back to that.
Thank you, Andrew. And okay, 1 minute.
Okay, thank you very much. I think it's possible to publish your results. I had one student, I think he was called Nyomujen. I don't know whether he's around. He said, I want to publish my work. And we guided him. He sent it to one journal. It was bounced. He sent to a second one, it was bounced. On the third one, it was published in January this year. And I have another student I supervised in the 2005 class, Kabayambi Chowan. She published her paper from Save the Mothers here. So what am I trying to say? All you need to do is team with your supervisors and some of us. We can even have a network where we can assist you. Bias when he's having some free time in the evening, you can read through. We can help you panopit your papers and publish them and esteem or whatever.
Great.
Yes.
This is great. I thank you again. Thank you again. Let's give a hand of applause as we request the team to walk down. Thank you. It's been brilliant of you. Now, a little alteration in the program. We shall have a presentation of awards coming now. We recognize the fact and the busy schedule that some of our guests do have, and we wouldn't want to lose your time. Absolutely. So this time coming forward is the next colleague taking us in that session. And thank you for honoring my my time with you. Thank you.
Let's give another round of applause for Peter for that wonderful session and for our presenters and panelists for the amazing work. Ladies and gentlemen, it's coming to 2 p.m. and we very much appreciate that we equally have mothers in the room and they should be hungry, but we are also hungry, so we need to eat. I want to take this honor and pleasure to introduce myself as Obed Kabanda. Barigayne calls me doctor because I finished my PhD, but I call myself Obed. And I'm going to take you into a very short session. We want to keep it as short as possible because of the time. I want to invite in front here the chairperson of the board, Canada, and then chairperson of the board, US, quickly. Come and take seats, and then our chairperson, representative of the chairperson board, East Africa, represented by Dr. David Mugawe, and who is also here representing the Vice Chancellor. I want them to come very quickly for some noble exercise we want to do quickly for the awards of our founding members of the board. And with due respect, I'm also going to invite our guest of honor to come in front as well, because there's something he's going to play for us. Our guest of honor, Dr. Charles Olaro, we very much appreciate your presence and we would like you to come in front here. We know you'll give your, session, but we'd like you to come now and do some bit of work for us. Ladies and gentlemen, we have very good, distinguished ladies and gents who have been very much instrumental to the work of Save the Mothers. And I want to invite Dr. David Mugawe to come and say a few words just about these very distinguished ladies and gentlemen as our founders of Save the Mothers before we can give the awards. Thank you.
Thank you very much. This gesture comes from Save the Mothers. And I do stand here on behalf of Save the Mothers Board, Canada, Save the Mothers Board, US, and also Save the Mothers Board, East Africa. But also this is for the entire fraternity of Save the Mothers. So dear esteemed founding members, Professor Pius Okong, Professor Florence Mirembe, Dr. Jean Chamberlain, Dr. Olive Sentumbwe. With heartfelt appreciation, today we honor the visionary architects and driving forces behind Save the Mothers. Your dear tireless dedication and visionary leadership have shaped the very foundation of Save the Mothers and also paved the way for impactful change in Save the Mothers motherhood, using the multidisciplinary approach to saving the lives of mothers and babies. As we reflect on the journey you embarked on over 2 decades ago, we appreciate your foresight, wisdom, and unwavering passion for our mission and vision that propel Save the Mothers forward. Today, Save the Mothers stands firm, inspired by your legacy of excellence for the maternal and child health. It is with great honor that we bestow upon you the Lifetime Achievers Award. Yes, as a fraternity, it's a great honor that we bestow upon you the Lifetime Achievers Award. To serve as a testament of your unparalleled dedication and selflessness and enduring legacy. Congratulations on this well-deserved honor. May your legacy continue to inspire and empower future generations. No mother or child should die or be harmed due to preventable childbirth complications. Sincerely and signed off on all the chairpersons of the boards and the chairperson of the STM board here. She's not present here, Honorable Sylvia Senabulia, but she's here represented to these awards.
Another round of applause. That's a very great message. Thank you, Dr. David, for reading that on behalf of Honorable Sinabulia, who is joining us online in Switzerland right now where she is, but she's able to listen into every presentation that is going on. We want to thank God for the technology. At this moment, therefore, let me invite Professor Florence Mirembe, who is receiving the first award from our team. Thank you so much. Professor Mirembe has been a very high-level icon in this work, and we want to recognize you for that amazing work. Take pictures. Thank you. Thank you so much. Thank you so much. And again, in line, let's have Dr. Jean, Professor Champlain, to come and receive another award. Thank you so much, Dr. Jean. It's been amazing, the work you've done from the very start. And then let's have Dr. Olive Mugisa Sentumbwe. Very wonderful, highly recognized, amazing work that you've done. Thank you so much, Dr. Olive Sentumbwe. I remember your first day of training me in family health. I remember at least. And then Professor Pius Okong. Woo! 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 I keep saying if we had, I don't know, if I was someone I would want to mention, but I don't want to. If I was a president of this country one day, Pius needs some very high level recognition. So Pius, Professor Pius, thank you so much for the amazing work that you've done over the years. Save the mothers. And let's take a group photo with them all. And as we take a group photo, Dr. Pius Okong and the guest of honor will remain behind because Dr. Pius Okong is giving us a keynote, and then he will invite the guest of honor to speak. Amazing. Thank you so much. Another round of applause. Congratulations. Congratulations. And at this juncture, I know and I recall that we have our Honorable Member of Parliament who is in the room, and I want him to come in front just to be part of this last session that we are having quickly. And at this moment, as he comes and as the guest of honor takes his seat, I want to invite Professor Pius Okong, who is going to give us a keynote address as part of the last session. And then we'll invite Honorable Member of Parliament who is in the room to invite our guest of honor. Thank you so much.
Good afternoon. I'm overwhelmed. I give glory to God on my behalf and on your behalf for blessing us in a mighty way. When I was invited to make some remarks, Dr. Nsubga kept calling every 2 to 3 days. I did not understand the enormity of what was going to take place. But I had prepared a PowerPoint presentation, but I have told them not to use it, and I will speak from the heart. Because first I thought it was a scientific conference, there'd be a lot of presentations, but I see that it's a lot of celebration. So all protocol observed, I would like to welcome our dear friends from the United States, from Canada, from Tanzania, from Rwanda, and all our dear friends from Uganda, to be hosted here at Uganda Christian University. The Deputy Vice Chancellor, Dr. Mugawe, convey our sincere appreciation to the university. I would like to mention the issues related to this theme that no mother or baby should suffer or die from a preventable cause in Uganda, in East Africa, and in Africa, and many of the low and middle income countries. Because we are able to prevent these problems at different stages. So Safe Motherhood was conceived and launched in 1987 in Nairobi, which is in the region here. And I was a brand new obstetrician and gynecologist. My teachers just left Professor Mirembe, 1 year old as an obstetrician and gynecologist. She said I was now mature to go out as an obstetrician. So that first decade of safe motherhood launched a major chapter where the scientists, the obstetricians, the midwives, the technical people in the Ministry of Health recognized that we cannot tackle this issue of high maternal mortality and children dying, especially around the period of childbirth, alone, based on our work as scientists and medical workers. And in that decade, we recognized clearly that we must bring other partners on board. And that's what happened in that first decade. We were trying to figure out how to go about it. There were a lot of civil society organizations and NGOs that came on board, mainly in terms of activism, and also providing some services in the community, family planning. But you remember that that decade was the decade of HIV/AIDS. And so it was a very trying time. In Uganda specifically, we were able to bring on board other synergies, and the midwives led the way in Uganda. We said we must re-equip ourselves how best to provide services. An American College of Nurses and Midwives worked with the Ministry of Health to re-equip health workers on providing what we call emergency care to mothers and newborns. And I remember my colleagues, Sandy Buffington and many other midwives from the United States coming to Uganda, to the Ministry of Health, to lead the way and to lead the obstetricians, the professors in obstetrics, and teach them how to care for mothers and babies in a different way. And the Center for Teaching the Ministry of Health identified was not the university. It was a humble hospital. It was St. Francis Hospital in Zambia, became the training site for life-saving skills. Number two, in Uganda, we saw what was called slim disease. And we challenged as healthcare professionals how to tackle this emerging problem of AIDS, HIV/AIDS. In obstetrics, we were caring for mothers and babies, and we were kind of saying, no, this problem is not with us, it's in the Department of Internal Medicine, because people were very small, falling sick, and losing weight. And we were relaxed in obstetrics. We thought we had no problem. And so we watched the people in internal medicine struggling with this disease for fishermen. But we took a bold decision that in Mulago, in Zambia, in Rubaga, and Arua and Gulu, we are going to find out if this disease is there even among pregnant women. And so the government of Uganda started surveillance for HIV/AIDS among pregnant women, 1987, 88, 89. When the results came out, it was a bombshell. By 1990, we had confirmed that 1 in 3 pregnant women was HIV positive in this country. Another bombshell is that we're not taking precautions. When we started looking at our health workers, we found that our midwives were having HIV. That was a shock. And at that time, I was in Mulago, 83, 84, 85. We used to rewash gloves. We used to wash needles and boil them. We didn't have supplies, so we'd make them last as long as possible. And that brings tears close my eyes. So my midwives, my dear midwives, working very hard, not only in Mulago, but many other facilities to wash these needles, wash the gloves, put them in a trough of Hibitin so we could use them again. Obviously, they got pricks. When we did the study, Professor Baragaini has emphasized the importance of research. We have to identify what's the issue here. We realized in terms of exposure, the nurses and other health workers perhaps would be more exposed than the midwives. We found the problem was handling these infected materials. And then we got on board other partners, multidisciplinary approach to health. So we got the community to appreciate the importance of HIV/AIDS. How do we move forward? We had no access to antiretroviral drugs. So we developed a model of caring for HIV/AIDS, where there's a lot of counseling and support, psychosocial support that could not be provided by obstetricians and the midwives and the physicians. Brought on board social scientists, counselors, the church, and faith-based organizations. And that care was called home care, and together with TASO, we were able to provide care for HIV/AIDS people in Uganda, late 80s, the early 90s. That's how we learned some of this is about multidisciplinary approach to health problems. So as a young obstetrician, as I mentioned, we also launched forward to do a lot of research, and Professor Mirembe and Professor Miro, the late, had a lot of faith in me as a young obstetrician, and in Zambia became a very important research site. And we were able to come up and identify a single drug, nevirapine, for HIV/AIDS, the first in the world, 1 tablet, plus other tablets taken for 1 week. Short course antiretroviral drugs. The research sites were Mulago in Zambia, were Dar es Salaam, Chuo Kikuu cha Dar es Salaam, and in South Africa. We learned to work outside the box. That was a very important learning for me as a young professional, to work outside the box. We made a breakthrough, and in order to get this on the table, Dr. Laro knows, once there's a new issue, a new discovery, how do you get it quickly to policy? We did not have the skills. But by 1997, we had to get this quickly on board because people were dying. Children were born with HIV. We had to have the skills of counselors, we had the skills of journalists, advocacy experts. We learned more about multidisciplinary approach to tackling health problems. And during that year, 1997, 98, we traversed the country, myself, Professor Mirembe, Professor Miro, and other people from South Africa and Tanzania. We met a number of presidents in the region. And the last meeting was in Abidjan, chaired by President Mitterrand that time, committing resources for women and children in Africa to have access to antiretroviral drugs. Nobody else had access. Those pregnant women first, to save their babies, not for their health. It was a painful reality. But we realized that, like a camel, you allow the ear first, then the head, and then the neck. Once the world had accepted that we shall save the children from HIV with a single tablet, 1 year later we're talking, now the mother is dying. Then the high-income countries could accept and say, okay, we'll give the mother also. Then we said, now the mother is also getting antiretroviral drugs, 1998. Haha, now the father has died. And by the year 2000, the ART programs were starting in Africa. That was a tough battle. Let's leave that. But I'm just demonstrating what it takes to bring on board multidisciplinary. That means there must be a problem. You look at and say, I do not have a solution. You must look left, right, behind, move down, move up, find anybody, a potter, a sweeper, social scientist, a witch doctor, a TBA, bring them on board. You are laughing, I will tell you about the TBA now. So 1997, we were celebrating 10 years of safe motherhood. I went to Sri Lanka. The day I arrived in Sri Lanka for the conference, they bombed our hotel. And so I was moved to another hotel where I was booked. And there was a very talkative Canadian there, I didn't understand his English. They brought us together, the bomb. Later, I recognized and learned that this person was the chief executive of the Society of Obs and Gyn of Canada, Professor Andre Lalonde. And he found that I was a member of the executive of the Association of Obs and Gyn of Uganda. So due to that stress of the bomb blast there, we could not go in town. So he said, let's hire a car and go outside Colombo. I said, what? But there are bombs here. He said, no, come on, let's go. So we went touring and we talked a lot. And born was the relationship between the Association of Obs and Gyn of Uganda and Canada. It was a bomb in Colombo. If there had been no bomb, I would have been another hotel, it would have been another hotel. And so he said, we wanted to collaborate with the Association of Obs and Gyn of Uganda. Can you tell the president that we are very eager? And during that conference, one of the decisions was that we should promote emergency obstetric and newborn care. So the International Federation of Obs and Gyn tasked member societies to come up with proposals to implement this approach. Naturally, Canada then started collaborating with Uganda. When I came back, I went to my president, the late Professor Miro. Professor Mirembe was the next president. I said, we must collaborate with the Canadians. And so a project was born where we started working in a district outside Kampala to try and see if we improved a facility, if we engaged the district leadership, if we engaged the community, I mentioned the TBS, can we increase utilization of emergency obstetric and newborn care services? So naive as we were, we didn't know how to do the things, but a project was born in Chiboga district, a rural district in Uganda. And we said it's mandatory that there must be an obstetrician in the district. It's mandatory that there must be midwives in every health center, 3, 2, not 1, according to the structure. And so we started rotating obstetricians. When we were there, some of the people who came to rotate through there was Dr. Jean Chamberlain. She was a young lady at that time, very dynamic and so on. She lived in that rural district and she went on that program through Kiyuni, Gayasa, Ntwetwe, and many other parishes and sub-parishes there. We found at that time the district had deployed traditional birth attendants in those health centers. We had to partner with them and buy them in. We discussed with them. We can also help you to deal with these women in these health centers. We did not use the hard approach just to go and kick them out. So we had regular meetings with the TBS and the community leaders, and they understood who we were, what we were about, because we were about to take over those health centers. At the end of the first year, after we had painted the hospital, restored the electricity and the water supply, the bed occupants went up from around 30% to 70%. At the end of the second year, 110%. We had the floor cases. Even the health centers were busy. The obstetricians were not busy operating. The obstetricians were meeting the community leaders with the midwives. That is how we learned about the multidisciplinary approach to health issues. That's why I was telling you, we collaborated with TBS and witch doctors. Now you understand. Yes, we went to the community and we had to have them come and listen. To cut a long story short, when the project ended, we had demonstrated the minister adopted the policy of emergency obstetric and newborn care, basic facilities, comprehensive facilities. We kind of left hanging, myself, Jean, Olive, and others say, now what do we do next? We felt to have arrived, projects finished, the ministers adopted, there's now a policy. What do we do? Others said, it's okay, we're finished. As they say, others fell by the wayside and so on. But the four of us thought, no, but we could start training people. Then we thought it's a certificate, it's a diploma, what should it be? And the like. So we toured a number of, went to Makerere, they listened, but they didn't seem to understand what we were talking about. We went to Uganda Matters University also on the other side. They didn't see, yeah, they appreciated, but they were still young. They said, okay, you wait first, we shall invite you later. We came to UCU, we prayed first. Eh? We prayed first, and the rest is history. We accepted here, and we've been here. And so the lesson is we foster looking out always for other people who may not be your kin or your type. Even though the problem seems to be clear that you can solve it alone, try to see if other people can make the results 100%, 110%. That's what it means to be multidisciplinary team, even for an obvious problem, even for a problem of an incubator in the hospital, even for a problem of getting more women on board. We must constantly be on that hunger and passion to bring other people on board, always be on the lookout. So the classes we ran at the beginning were fantastic. We brought police officers, we brought media people, we brought teachers, brought social scientists. It was a physical class. And we tasked them with case studies. This is what's happening in that health center 3, this is what's happening in that sub-county, way forward. And the police thought he had no role. We said, but hey, this other girl here was raped and came there. That's why she's pregnant. So what happened at the police station? And the media raised the story about this and went around the class, sharing and discussing. That's how we started. That interaction, that coming together with people of different backgrounds, some were about to retire, some were young, and so on and so forth. Some had worked, private sector, public sector. It enriched the experience of an academic program. So we had to learn how to have an academic program. The university was very strict. National Council of Science and Technology was very strict with our ideas of what we had experienced in Chiboga and bring this together. And so those classes were that kind of hybrid. So that our hope and our belief was that when the graduates finish, although they struggle with the research and come out with a paper and a report, there must be people who are witnesses, people who are witnesses of the goodness of God when they go back to practice. They get the academic paper, they finish the research. That means now they have learned to think systematically and document things and write that report. They have experienced the interaction with other professionals. They will continue on the ground to look for other people to be with them, whatever they do. And I hope the university will again rethink, even if the National Council of Science and National Council for Education says master's programs should be virtual. This particular program, this physical interaction is the core of training and formation. Because interaction with the students from Tanzania, from Rwanda, who had some from DRC, West Africa and so on, working different settings. That's what enriched the experience. That's what gave them the knowledge, and that's what spurred them on. And that's what was sustainable when they had left the university. They learned, they saw, they shared, they experienced. When they went back, you can witness and you can listen to the testimonies. And that's where I would like to end by saying that this program should continue, yes, but should bring back that physical presence. I found it very difficult in the last few years, especially after COVID, during COVID, to be able to make people experience that oneness and share in a way that when they leave the university and get the degree, what's sustainable is what they have experienced and what they have learned. And so I think one needs to see how to strengthen that and bring it on board. I would like to conclude here by saying these are my thoughts about multidisciplinary. You don't learn it by head. You need to experience it, then you're able to continue and sustain it as a way of life, not just for a project. It's a way of life. Can we all repeat that? It's a way of life. That is it. It's a way of life. And so it's my honor to invite the Honorable Member of Parliament, I've been told Harari, Charlie, to make remarks and then invite the Director, Clinical Services. Thank you.
Thank you so much, Doctor. And I'm very glad to be here today. I think I was in UCU I think 20 years ago. I'm an alumni of Uganda Christian University. I'm called Eric Musana Achari. I am a member of parliament from Buyaga East constituency and Kagadi district. And I'm glad to be here to be part of this intervention. I didn't know that I'm supposed to say hi to you. And I'm very glad because I've been interacting with my colleague Andrew, whom we work with in Kagadi, and basically working on a number of interventions on how to save mothers. First, there are two interventions as government of Uganda. We are working so hard to make sure that mothers are safe. And I have liked the statement that no mother should die, no child should die in whatever circumstances. And just to comment that it is a responsibility of everyone to save a mother. It's not just a responsibility of government, it's not just a responsibility of a church. It is my responsibility. It is your responsibility. And when I was coming here, someone was asking what are the budget constraints? What are the budget interventions as a government? You know, now we are in the budget cycle as Parliament of Uganda, and we are saying that mothers should be catered for, and mothers should be saved. Mothers should be given a better budget. We know there are several challenges. Of course, the national cake has to be further divided into other sectors because just like we know, it is multi-sectoral, multidisciplinary. You don't look at only the health centers, but also look at other infrastructures. Lastly, as I invited our chief guest, as a member of parliament, you may ask yourself, what is it that you have done to make sure that we save the mother? Most significant, which is unique to me as a member of parliament, I have actually procured an ambulance, a community ambulance for our mothers in the constituency. And I've also distributed about 50,000 mama kits, the mothers you know. Mama kits to see that these mothers go through safe deliveries and we see how things are being done. And number three, I've also participated in community building of community health centers. I've liked what Peter was demonstrating. I've done like what Peter is doing about 3 community health centers and using locally available resources. And I've liked it local solutions and local problems with local universal solutions. So we are adding on the universal element. Thank you so much. And now allow me to invite the chief guest tonight to share with us his experiences and also advice to us on this concern. I thank you so much.
Thank you, Honorable. It's really a privilege to be invited by the Honorable Member of Parliament. The representative of the Vice Chancellor of Uganda Christian University and all your leadership, the founder members of Saving Mothers East Africa, the alumni, maternal and child health partners, ladies and gentlemen, I am first want to start by recognizing my teachers. And I'm happy that first they have been recognized. I think 3 of them were here. Professor Pius. Actually, when I finished in medical school, I actually wanted to do internship in Zambia. By that time, the placements were very few. So I couldn't succeed to go to in Zambia. But I went equally to Lacho Hospital. That's where I did my internship. Professor Mirembe, Florence Mirembe, and then Dr. Olive Sentumbe, whom for us in the family planning and the reproductive health, we know her as a senior adolescent because she's really now, that's where she's putting her energy. You know, as Uganda, as a young population, that's really where we, most of the issues we are talking here actually happen around that what? Around that spectrum. Saving Mothers East African Conference is definitely key. And I think most times we talk about the free delays and the observation. That's why I think we all are necessary. Because you can actually be able to do the best, but if probably there are delays which definitely you don't have control over them. And that time it might now have changed, but I looked at one paper where they say that the delays, if you looked at all of the mothers we lost, almost 80.5 of them had one or the other what? Delay. And the common is definitely normally the first what? Delay. And that's where sometimes the health worker does not have the power. And that's why we need to have the community engagement, which is key. Because if you don't do it, then you will continue mopping the floor and the tap is what? Is leaking. So we need to be able to look at that. So I am here to bring you greetings from the Minister of Health. And I did get these invitations. I think it was over 1 month. I did promise that I was going to come. But at the same time, I was also praying that nothing else takes me out of what? Of Kampala, because I had committed myself to come. Actually, this morning I had a program in Jinja. I do stay around in Zeta, but I had to go to Jinja because we're training what we call emergency medical teams so that we avoid chaos and uncertainty when we have outbreaks. So we're trying to build up teams. So far we have trained about 107. so that if there's an outbreak, you just only pick them and do what? Deploy. But that's important, but also much more important is that Olive and I were part of the continuity of essential healthcare services. Because we're looking at that, definitely you can have outbreaks, but we'll have probably lose more mothers and children if you don't continue to apply what? The other services. So we have also put that guidance that whenever there's an outbreak, you have to be able to keep tabs on all the other things. So I stand here definitely with the sense of honor as we convene for the Safe Mothers East Africa 2024 Maternal and Child Health Conference. This gathering definitely represents an assembly of very passionate and vigilant multidisciplinary professionals under the leadership of Save the Mothers Masters of Public Health Leadership Network. And this is united by a shared commitment of advancing maternal and child health at grassroots, family, national and regional and global levels. And at the same time, I want to recognize our colleagues from Canada and the US. So the theme of the conference that no mother or child should die or be harmed due to preventable childbirth-related complication, and the role of the multidisciplinary professionals offers an opportunity for us to reflect as leaders on how we can be able to impact this intervention that we need to undertake to avert these preventable deaths. You have heard from Masa from Soroti that you can actually have blood in the blood bank, but there's no blood when actually is needed at where is the what? Health facilities. So you need to be able to address that concern. The power of communication, I think she also shared it, is key. So we need to be able to do that. So we need to be able to undertake preventable maternal and perinatal mortality and morbidity. And as a country, we now know why the mothers die. But we must report on the positive side that we are happy that 91 of the deliveries now take place in the health what? In the health facilities. And if we look at 1.6 deliveries each year, you are looking at definitely about 10% of them still taking at what? Place in the facility. And when you talk in percentages, definitely it gives you a very erroneous that you are doing what? Very well. But the 10% is actually about 160,000 mothers delivering in what? In health facilities. And the only way you can be able to pick up any complications is to be delivered by a trained health worker in the health facilities. So for us to be able to address aspect of safe motherhood, we have to look at all those pillars. And I was happy again with the colleague who said that we're addressing first the aspect of antenatal, because if you address antenatal, then you get able to give who are the high-risk mothers who need interventions. So we know for every single life of a mother lost, her children lose her, and definitely the family has lost. So her community has paid and unpaid labor for all those aspects which definitely do. So we need to look at that, this definitely as a developmental issue, and implies that death of a woman is an enormous loss to the family, the community, and the country. So we need to be able to look at that. Just 2 days ago, I was meeting at some neonatologists from some country. And whereas for us here, we are struggling to see that we save babies who are born at around 26 weeks. For them, I think their cutoff point now at 24 what? And probably others have even gone lower. So we need to be able to see how do we save these babies. On the side of babies, prematurity is key. because of aspect of bus asphyxia. And so we are trying to see how do we roll this. So we need to look at what happens in these maternity rooms and what is the quality which we want to do. So we so far know what needs to be done, and just we need to be able to see that all of us put our effort in that. So as a way of averting preventable maternal death and perinatal death, the Ministry of Health has established the local maternity and neonatal systems, which are our regional catalytic mechanisms for delivery of reproductive newborns, child and adolescents. These definitely are at different levels, but there are those which definitely have performed very well and really want to applaud them. We've been able to empower them, and they have really been able to emerge at leaderships. And now they are even able to have regional, local maternity conferences to be able to look at what are the things which they need to be able to do. I think last 1 month, I was privileged to attend the one of the Elgon region. So that's the way we really would want to do, because we want to see where are these hot spots and what are the issues which we need to be able to address. But I must say that this same approach, we are also trying to see how can we use it to leverage on other services. So we're looking at that, we're looking at how can we use it to handle other emergencies with the same approach by identifying where there are gaps and seeing how to address them. So the improved maternal and perinatal surveillance response has been hastened to respond to identify local gaps and observe to improve multi-sectoral coordination. And when we speak on this, we are brought up the level of the chief administrative officers to be able to speak so that they're really able to find solutions. Because if you know previously, we would just review, and then we come to review another maternal death, and we have the same issues. I think now we've been able to change that narrative and be able to see that actions are implemented. One of the key tasks from the last joint review mission which we had was to functionalize, I think, about 54 health center force, which are what? Because those are the points of where there are complications, then mothers need to be delivered by CISA. So we are working progressively. I've been telling the Commissioner Reproductive Health that we now need to keep ticking up how many so far we've been done, so that by the time we have the next GRM, we should really be at the bottom of the what? Bottom of the list. So as a result of these efforts, of which I'm sure that this program contributed, there was a significant reduction in maternal mortality rate from 336 to 189 per 100,000 live births. And the newborn mortality equally reduced from 27 to 22 per 1,000 live births. So this is contributed by all the efforts which were what? And I'm sure that if you look at the WHO building blocks, which Olive is a consultant, the key one definitely is aspect of issues of leadership. Because you can have all the others, but leadership makes what? The biggest difference. So we need to be able to really address this. So the solutions, despite these strides, definitely we continue to lose more mothers due to preventable causes, including obstetric hemorrhage, preeclampsia, sepsis, birth asphyxia, and complications of prematurity. To address this, definitely government is investing in the health center of risk. I think all of you know about that. So that is kind of like a mini hospital. We've reviewed the structures from initially only two midwives to now to about 8, 9 at that health facility. We just need to get, since the Honorable Member of Parliament is here, to get resources to be able to do what? To fill those positions, and we can be able to address that. The solutions of these current gaps lie not only in the hands of the healthcare workers, but also in a collaborative efforts of multidisciplinary professionals like those who are gathered here today, that your dedicated work shows transformation powers of collective actions, resilience, innovations in implementing impactful interventions that saves lives of mothers and babies. So Ministry of Health acknowledges the role definitely institutions, academia like UCU is doing on saving mothers for its innovative approach, which have trained multidisciplinary professionals and championed change and contributing significantly to the change was saving. So I think all this is instrumental, but respectively and dignified maternal care. So as I conclude, to save mothers, approach of empowering in multidisciplinary professionals through the Master Public Health Leadership Program is pivotal to shift our mindset of what we need to do collectively. We cannot be able to do them as health workers. We need your effort. We need to be able to see how do we address these delays. Delays to make a decision. Definitely, the men in the room, we have a lot of role to play, because sometimes some of the delays is blamed on the men, because you have to first give authority before the wife attends care. Or you have not empowered her with the resources to be able to seek care. So we need to be able to address those aspects. So let's seize this moment to take decisive action regardless of the professionals and the strengths of partnerships which we have as key stakeholders. Together we can strategically move towards achieving the SDGs, because as I did mention that we are 189, but our target, we want to move at 70 per one. That's the HDG target. So you see that we still have unfinished business, that we put some effort, but we need to put more effort and sustainable effort, so that we don't lose the gains which we have done. So through a collective action and unwavering commitment, we can envision a future where every mother and a child not only survives, but thrives. No mother or child should die or suffer from harm and preventable complications. I think that's the message which all of us should leave here clearly in our minds, and looking at that, we have got a very big role to play. Let us rise and address the tragedy of maternal and child death and make a meaningful difference in the lives of the mothers and the children everywhere. So thank you very much for listening, for God and my country.
Let's have another round of applause for our guest of honor for those very wonderful words and recommendations that he's giving for the next steps. We are reaching a level where we need to close this session and go for our lunch. But before we do that, we want to make some few recognitions, and before the guest of honor and Professor Perez and Honorable Member of Parliament leaves the stage. First of all, we want to recognize all our alumni who are here. Let's, clap for ourselves for such a good attendance that we've had. And our online community, there's a huge community which is online right now, watching us and listening in. We want to thank you for your attendance. We want to thank the organizing committee for this very wonderful conference, and led by, Topista, who has been here. Let's clap for Topista. I mean, she's been a very wonderful person in organizing this. We want to recognize our partners. AMREF is still here. I think AMREF is still here. We want to thank you. We had PATH, we had She Foundation, Telewadi, Uganda AIDS Commission, and all our exhibitors who had a lot of exhibitions. We want to thank them as well. And our funders, Leila Reader Fund, Strong Together, Jeff's Family, and Sisters of St. Joseph. We want to thank you all for all your funding for this wonderful conference. But we want to especially recognize with certifications our presenters very quickly. Let's have those certificates here, and we do that very fast before the guest of honor can leave. So let's have Rogers Mandu here come and receive your certification from the guest of honor here. Quickly, as Irene Nakamati comes along, and Silvano Tembo, thank you all for your wonderful presentations. Those were very wonderful presentations. And then we have the panelists here. We had Joan Mugenzi, who is moderator, was here. I think she's still around. I think she's left. Someone could receive it on her behalf. My friend Peter Olet, for the wonderful work you just did. Thank you so much. Come and receive that from the guest of honor. Lilian Akuzi. And then I'll also recognize our panelists, Dr. Justus Bergane. Welcome to receive this wonderful certification. We recognize your effort. And then as Namayanja Ann comes along, Namayanja Ann. And then Martin Agilong. Martin Agilong. Martha, sorry, I'm very sorry. Martha Agilong. And then Moses Chankwa. Moses Chankwa. And as Dr. Jean, who was also a panelist this afternoon, come and receive your certificates. We want to recognize your effort in today's conference. And so Martha. Thank you, Jean, for that wonderful support. And then yes, Martha, all the presenters, those were very wonderful presentation. And we want to appreciate you and keep doing that wonderful work. And then cameramen, let's have that photo with everyone. And then myself, I think I can't forget myself for the wonderful. Yes. And we are going to be having some lunch very shortly, and we will be having some cards passing around. Thank you so much. Once again, I want to recognize my lecturer and former executive director, Dr. Mkoza, who is still in the room. Let's clap for Dr. Mkoza for a wonderful work done, for the transition, for all the effort in recruiting our new executive director and assuring that he settles in the office. We want to thank you. Let's enjoy our lunch. Let's pray for our lunch. Let's pray for our lunch. Father God, we want to thank you this afternoon. We want to thank you for the opportunity to be here together. We want to thank you for all that we've been able to accomplish. We want to thank you for the lunch before us and pray that you give us a blessing as we partake of it, that will nourish our bodies for us to be able to do your work. In Jesus' name we pray. Amen. Thank you. Thank you so much. And remember, we have a second session going in, the inaugural annual general meeting that is coming at 2:30. Let's keep time. If we can keep our lunch short to 30 minutes, that would be great, so that we can have the inaugural annual general meeting. And I hand over to Andrew to announce some more pledges. Thank you.
Yeah, thank you, Doctor. There are some pledges which came along. We have Nakabubi Fazira, a pledge of 100,000. That is class 2018. People, let's clap for these people who have pledged. Nakabubi Fazira, class 2018, 100,000. Mandu Rogers, 500,000. Yeah, people could be getting their lunch, it's fine. Then we have Martha Ajrong, 100,000 pledge. Enos Mate, 50,000 pledge. Umar Masereka, 250,000 pledge. Busoga Harris Forum, 1 million. Reverend Betty Mbambu, 200,000. Nanyunja Justin, 150,000. A Team Grace, class of 2023, 300,000. Yeah, the longer awaited pledge cards have come and we have packed them in different envelopes. We have Tanzania, you have 10 pledge cards. Sudan, you have 10 pledge cards. USA, you have 20 pledge cards. Canada, you have 20 pledge cards. Kagadu region, here are your pledge cards. Northern region, here are your pledge cards. Buganda region, okay. Here are your pledge cards, and Busoga region. So generally, we have packed for different people as they go. They can continue with the drive amongst themselves or with friends. As we enjoy our meal and lunch, right now we are inviting the Triple P come forward for entertainment. Thank you very much. Enjoy your lunch.
Kasa tuyanze. Nyabo kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Jagala nyimbe ngomuganda wabera kasengeje engome buga taksimba. Jagala nyimbe ngomuganda wabera kasengeje engome buga taksimba. Kasengeje banyabo kasengeje
Kasendeke wetukuba paksimba. Kasendeke anyabo kasendeke. Kasendeke wetukuba paksimba. Kasendeke anyabo kasendeke. Kasendeke wetukuba paksimba. Kasendeke
kasengeje engome buga taksimba. Jagala nyimbe ngomuganda wabera kasengeje engome buga taksimba. Jagala nyimbe ngomuganda wabera kasengeje engome buga taksimba. Kasengeje anyabo kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Kasendeke banyabo kasendeke engome buga taksimba. Kasendeke wetukuba paksimba. Jagala nyimbe ngomuganda wabera kasengeje engome buga taksimba. Jagala nyimbe ngomuganda wabera kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Nyabo kasengeje
wetukuba paksimba. Kasendeke anyabo kasendeke. Kasendeke wetukuba paksimba. Kasendeke anyabo kasendeke. Kasendeke wetukuba paksimba. Kasendeke anyabo kasendeke. Kasendeke wetukuba paksimba. Kasendeke
kasengeje banyabo kasengeje engome buga taksimba. Kasengeje banyabo kasengeje engome buga taksimba. Kasengeje ayere kude kare kore miru ayere pamuru ayere kude kare kore miru ayere kude sayantolo ayere kude kare